Hello. Hello.
Hi.
How you going? I'm Chris.
Chris, Amy, nice to meet you.
Good to see you, Amy. Here to help.
That's spectacular.
You're excited about that?
I am always excited about more help. Since we do always have a full house at the Esther Honey Foundation, having extra sets of hands and extra help is always appreciated and takes a little bit of the burden off of us. Consultations happen in there.
Yeah.
Got our feeding and laundry in there. Over here, surgery and x-ray.
All right. I've only had a quick look around, but already I can see the conditions are pretty basic. There's one consultation room and very limited medication and equipment. Yet somehow, these guys are on the front line when it comes to helping out the sick and injured animals of the Cook Islands. I'll put my box down.
Yeah, do that.
We'll get started.
Sounds good.
Minutes later, the first emergency call comes in.
Got your gear?
Yep.
All right.
Let's go.
An animal has been found injured after a hit-run accident.
Looks like a puppy's been hit by a car, so we're just gonna go see what we can do to help that little dog out.
So this is pretty typical of what happens around here, I guess, with dogs not having fences and...
Yeah, it is pretty typical. It's also relatively typical that we need to go out and collect them because, as you're seeing now, most people just have motorbikes.
To be honest, as I'm arriving with Amy, I am expecting the worst. The cars on this road move quickly. So, the outcome surely can't be good.
Hi.
Hello there. How you going?
So what happened?
She's been hit by a car. I was telling her to get up, but she lay there and her eyes were looking at me.
All right, so we'll just check her out now and just have a little look over her. Obviously, a lot of the pain is down the back part here, but we'll just start at the front. Even though Princess is moving around, the concern is always internal injuries. If she has something serious in there, like a bleed, she could have minutes to live. It's okay. I know.
Good girl, honey. Okay, so this dog's come in and she's not looking good at all. Hey, that feels really bloated.
At the Bondi Referral Hospital Sash, 6-year-old Molly has been rushed in with a badly swollen stomach.
When I feel her abdomen, it does feel bloated. She's really not in a stable condition, so we've got to act fast.
Emergency vet Dr. Lisa Chimes is worried the listless greyhound has a dangerous condition called bloat.
Their stomach basically fills up with air and becomes massive. And the risk is that stomach can twist, cutting off the blood supply to vital organs, and that can kill them. All right, honey, let's get an x-ray done.
Owner Bethany is a former vet nurse and recognised the symptoms straight away.
I've had a dog pass away with bloat about 10 years ago, and seeing Molly's symptoms, it kind of has given me a big scare, and I'm just hoping that what they find is not what I'm thinking, but I'm worried.
All right, come on, Molly. That's a girl. I need to take an x-ray of Molly's abdomen right away, because if she's got a bloated, twisted stomach, her life could be in serious jeopardy.
So she's just in a little bit of shock over what's happened. Just a little bit pale there.
In the Cook Islands, Chris has rushed to the aid of hit-run victim Princess.
So I just want to make sure that in the accident she hasn't done something to her lungs, and just make sure her lungs are inflating properly. It looks like she's breathing fairly normally. Even though Princess has been up and has been moving around, the fact is she's not out of danger yet. The force that Princess must have been hit with had to be quite substantial. You can see she's whimpering when I move around her hip here. So that seems to be the sorest spot of all, is just up in the upper part of her leg. Isn't very comfortable for her. The obvious concern for me is that Princess has a really nasty fracture of either her femur or her pelvis. If either is the case, the consequences for her could be incredibly serious. I think the best thing to do is take her back to the vet clinic for an x-ray, and then from there the best thing we'll be able to do is work out exactly how severe her injuries are and what she needs from there. Okay. That sound all right with you?
Owner Mary and her niece Stephanie will be devastated if they lose their much-loved princess.
I'll do anything just to keep her on her feet and make sure she's all right. As long as she comes back and she's fine, that's what matters the most.
Okay, so we'll talk to you soon. Yep. Okay, no problem. At the back of my mind throughout all of this has been the fact that the Cook Islands doesn't exactly overflow with orthopaedic surgeons or orthopaedic equipment. See you soon. If we do have quite a serious injury here, then I'm not sure exactly what we can do for it. Oh, where's X-ray?
Yeah, X-ray's down here to the right. Take her right in.
Back at the Esther Honey Foundation, Chris and Amy are about to X-ray hit-run victim Princess.
Hey, it's okay, it's okay. It's okay, it's all right.
Chris is concerned the young pup may have sustained extensive injuries to her pelvis.
The force that Princess must have been hit with, it had to be huge. Her body can only sustain so much, so I'm expecting her injuries, unfortunately, to be substantial. She's a tough little thing, isn't she?
Yeah.
You're hit by a car and then trying to run away.
Yeah, most island dogs are pretty tough. We do have quite a few three-legged dogs here in the Cook Islands, and that is mostly due to hit by car, road traffic accident. Because of the free wandering lifestyle that they have, they oftentimes cross the road, and sometimes they're smarter than other times. Sometimes they look, sometimes they don't.
Chris is hoping an injection of painkillers will help calm the distressed pup.
Here we go. You don't have to play the tough girl anymore. There's really no way of knowing what we're going to find in these x-rays. Most of Princess's pain is in the upper part of the leg, so obviously the focus has to be there. 1, 2, 3, go.
Okay.
Thank you.
All right. So you can take those up, get those developed. In the meantime, we'll put her in a cage so she can rest.
If we see quite severe damage on these x-rays, there is only so much we can do. With limited resources and limited equipment, orthopaedic surgery here is a very rare event. So, worst case scenario, she may need to lose that leg. Just take it easy, girl. I'll have those results for you soon.
We just need to get a picture of your tummy.
At Sash, 6-year-old Molly is about to have an X-ray. Lisa needs to confirm whether the greyhound has a potentially fatal condition called bloat.
I need to know if her stomach is twisted, because if it is, she's going to need surgery straight away. All right, good girl. Stay there, Molly.
Molly's devoted owner is anxiously waiting for the results.
I'm hoping it's not bloat. I had a dog 10 years ago die because of bloat, which is really scary, and I just hope that she pulls through.
Oh no, this is bad. When I look at Molly's x-ray, her stomach is absolutely massive, and it's very obvious that it's twisted. Now, that is something that needs surgery, and without it, Molly won't survive. So, I've taken an x-ray of Molly, and it shows that she has got a bloated and twisted stomach. So, she needs emergency surgery.
Okay. Can I see her?
Absolutely. Come through.
My greatest fear is losing her, and that's not an option for me. I just want to make sure that she's okay, and I just can't lose her.
Molly's life-saving surgery needs to happen immediately.
You'll be good. You'll be good, okay?
It's absolutely heartbreaking just to think that she's about to go through major surgery, and I just can't be there with her. My biggest fear at the moment is she doesn't come home. Sorry.
So the human hospital's okay with 4-legged x-rays as opposed to 2?
Oh, absolutely, absolutely. They let us use their developer, and we just bring a disc and burn our radiographs on there, so we're not taking up any of their space.
It's a real community thing around here, isn't it?
Yeah, it really is, it really is.
In the Cook Islands, Chris is quickly realising how tough it is to care for the local animals.
This This is it?
Yep.
He's just had to make an emergency dash to the nearby hospital, the only place with facilities to process Princess's x-rays.
The fact is, if we see a really, really bad fracture here, there's nothing even a human hospital could do for Princess on this island. Wow. Didn't expect that.
No.
She has just somehow taken a hit.
Moved on.
And moved on. The femur is very much intact, going to the head of the femur, into the pelvis. There's really...
Looks really good.
No problems there at all.
No.
Which is quite remarkable. So we'll just have a look at the other view just to make sure. I mean, going from the knees right up to the pelvis here, she was whimpering when we touched those areas and flexed them.
Yeah.
But it looks like it's just all been soft tissue, just bruising really.
Yeah.
You do assume that just to survive around here, the dogs have to be, I guess, tougher than your average dog. And Princess, despite her name, is clearly no different. She somehow managed to, whilst crossing that road, see that car at the last minute, take the impact and walk away without any fractures. What do you reckon? Is she gonna be okay?
I think she's gonna be fine.
Yeah. Hey, you don't know how to look sore, do you? Come on. See you walk. You get up? Get up for us?
Oh, don't take off there.
There's not a lot of limping going on anymore.
Little.
Just a little one.
Tender, but pretty good.
You see you walk? Come on. Hey.
Princess's prognosis is actually a lot better than we thought when we first saw her. So bumps and bruises, nothing catastrophic, and she can go home with some pain medicine, rest, and recovery. Really lucky dog.
Oh. That's a catch.
Nice catch.
After all the panic of earlier, now it really comes to the nice part. I'm sure Mary and her daughter are sitting at home worrying about what's happened to Princess. We can give them the good news.
Good girl, Molly. All right, sleepy, sleepy girl.
At Sash, 6-year-old Molly is about to undergo an operation to try to fix her badly twisted stomach.
All right, let's get her up. Okay, Pops. Having a twisted stomach is one of the most life-threatening conditions a dog can have, and if we don't operate on Molly, there is no way she'll survive. Oh no.
But suddenly, Molly's system begins to crash.
Her ECG is showing that her heart is racing. She's got a really dangerous arrhythmia, and if we don't treat it, that could kill her instantly.
Molly's abnormal heartbeat is a sign that her stomach is causing extreme pain.
We need to stabilise Molly and get her heart under control before we do anything else.
Lisa and the team are using a pain relief drug to try to lower Molly's heart rate.
Heart rate's 112. Slowed a lot. Let's just get her in there, right?
Surgery can now get underway, but everyone is still on edge.
Molly's an unstable dog. Now she's under anaesthetic, anything could go wrong.
Specialist surgeon Dr. Ricky Cashmore will perform the delicate operation.
The goal of this surgery is to get the stomach untwisted and deflated as quick as possible. And that way we've got the best chance of saving both the dog and the stomach. Just hang on 1 second. So additional to the stomach actually twisting, the spleen is twisted too, and all the blood supply to the spleen is actually thrombosed and clotted. So to prevent it from actually rotting in the abdomen, we're going to have to actually remove the spleen. Okay. We've been able to remove the spleen successfully, and now we need to untwist the stomach. Okay. Oh, wow, that's quite nice. Fortunately, her stomach has returned to normal colour, so she doesn't appear to have any permanent damage, which is very lucky.
With the stomach untwisted, Ricky is now going to stitch it to the abdominal wall. This will prevent it from twisting in the future.
That's it.
Awesome.
Although the surgery's gone well, there's still a small chance she could have serious problems, so she's going to have to recover in the ICU, where she'll be monitored closely for the next couple of days.
Hey, you smell where you are? Yeah? Come here, come on. Other one.
In the Cook Islands, it's time to reunite Little Hit Run survivor Princess with her owners.
What is it with you jumping? As I'm carrying Princess towards Mary and Stephanie, the look they give her is just one of absolute relief. They're overjoyed to see her again and just happy to have her home.
Oh, she's excited.
She's excited, yeah.
Hiya, princess.
So she's still a little sore, which is to be expected. And she's going to have a bit of bruising there for the next few days. But considering what she could have been facing,
Yeah.
it's a very, very good result.
I'm just grateful enough that you have saved her and brought her back and nothing has happened to her.
Well, you're beautiful people, and I can see how much she clearly means to you and how much you mean to her, considering that tail hasn't stopped wagging the whole time.
We are grateful to both of you.
It's great that the whole Esther Honey Foundation exists, isn't it? It's going to be hard to forget my first patient in the Cook Islands, but really she's demonstrated perfectly exactly the role these pets have in everyday life. They're part of the community, they're part of family, and they mean the world to these guys.
It's okay, sweetie. Good girl.
At Sash, Sonia from the animal rescue group Fetching Dogs has arrived with Rogue.
Just a little bit concerned about her right eye. So when we rescued her, she had some opaqueness to it, but now it's changed and it's gone red. We really need to investigate and get the eye fixed as quickly as possible so that she can go on and find a really wonderful, loving family, because she really deserves a great home.
Okay, so what brings Rogue here today?
We've just gotten her from the pound recently.
Yes.
And her right eye is, I don't know, it looks damaged.
Yeah, that doesn't look right at all. Wow. So it was like that when you got her?
Well, it was damaged, but it was like blue, and now it's gone red, so I'm just like, what's going on?
There are lots of different things that could be causing Rogue's eye problem. I need to run some tests to try and work out exactly what it is. So I'm just going to check the pressures in her eye.
Good girl, good girl.
All right, so that pressure's normal. She hasn't got a build-up of fluid behind the eye, which is glaucoma, so that's a good thing.
Yeah.
But it still is very, very unusual in such a young dog to have an eye like this. So I'm just going to examine the rest of her head too.
Yep.
Have you noticed this lump on her cheek?
Where's that?
Just here, under that eye.
Oh, okay.
Yeah. Now it concerns me a little bit that it might be related to the eye. And when any animal gets a lump, we need to make sure that it's not cancerous.
Yeah.
So what I'd like to do is I'll get our ophthalmologist to come and have a look at the eye, give me her opinion.
Okay.
Okay.
Yep, that's fine. Anything like the C word's always scary. So I'm a little bit worried about what that's going to turn up, and that's just a little scary.
Ophthalmologist Dr. Alison Groth will be able to confirm if Rogue's eye can be saved.
Gosh, that's a very unhappy looking eye. So I'm just looking now at whether her pupils respond to light. They should become smaller when I shine a light in them, but she doesn't seem to have any vision at all in that right eye. It's likely that that eye will cause problems for her in the future, and that the best thing we can do for Rogue is actually to remove that eye.
Okay, so leaving it there is not going to work.
I'm concerned that it will become painful for her in the future.
Yeah.
Now we'll also look at taking that lump out as well, because we are really wanting to make sure that it's not cancerous and that the eye isn't cancerous either.
All right, well, I guess it's got to come out.
It's a heartbreaking prognosis, but Sonia knows surgery will give Rogue the best chance at a happy future.
I was really hoping that we'd be able to keep the eye, but to save her any further pain, it has to come out. You be a good girl for Auntie Lisa, and I'll see you tomorrow, okay?
Rogue is such a beautiful puppy, and I really, really hope that we can get this eye problem sorted so that she can go to a brand new home. But if she's got cancer, well, that's going to make things very difficult.
My next patient's in a box with a food bag over the top. Around here, anything can happen.
At the Esther Honey Foundation in the Cook Islands, a mysterious patient is waiting to see Chris.
Hello.
Hello, Chris. Good.
Thanks for waiting in the waiting room.
That's all right, pleasure.
Go on through.
Okay.
I really want to know what's in here.
He's heavy. So I hope it doesn't flap all over the place.
Tell me what's in the box, please.
A Muscovy duck, a large one.
Muscovy duck.
Yes.
Annette is worried about Manny, one of her pet ducks.
Oh, hello. You've been hiding in there, have you? Didn't expect to have a look in here and see you. No.
Manny seems friendly enough, but I'm seeing a big box and I'm seeing a lot of rope. Maybe I haven't quite seen the full Manny picture yet.
Very much so. Now you know why I closed the door.
Kind of making you look a bit foolish right now. Okay. So you're strong.
You never like to admit it, but this duck, he's got my measure. He's only small, but he packs one hell of a punch.
Hey, buddy, no, don't start that again. We've already seen you're a big, powerful man. You are. I believe you. You don't need to show it off. Okay, so this leg.
It's this leg, yeah.
All right. Is that his normal posture now, where he's leaning to one side?
When he stands up, he leans on one side. When he tries to walk, it's walking sideways. Yes.
Okay. So I'm just going to feel up from his hip joint right down to his knee and just see if we can work out where this problem's coming from.
Despite the show of bravado with Chris, it seems Manny isn't sticking up for himself at home.
My gut feeling is that Manny's damaged his leg in a fight with one of the other ducks. When male ducks fight, it can get really brutal, and often the weaker male walks away with some pretty serious injuries.
Okay, all the bones feel pretty intact there. He does have quite a bit of scar tissue running across the base of this leg here.
This is the strange thing. When I feel it, it feels pretty normal. But I do need to see how well he can walk, because if he can't, then he's facing some serious problems.
We're now walking the duck. Let's go. Come on. Come on. Okay, can you see where that foot goes? So he actually puts the foot out to the side.
Yeah.
And moves his right leg more underneath him. There's a definite limp there. As soon as I put Manny on the ground, it's clear there is a problem. He really struggles to put any weight on that left leg whatsoever. So you can be sure he's in a lot of pain. Can you imagine if you had busted your ankle, how you'd walk? So you use your right leg more. With this other one, you keep that foot as straight as possible. And it's exactly what he's doing. So it's something he's been dealing with for a while, but there's a reason why he's still got a problem after all this time.
Yeah.
I'll go inside and I'll tell you. I can't relax until I've caught him. Come here. Go on. Let's go. Let's go. See, I got you that time. Oh, almost.
Hey, Molly. How are you doing, honey? Come on out. There you
At
go.
Sash, it's been 24 hours since Molly's life-saving surgery.
Molly came in here yesterday with a twisted stomach and she needed emergency surgery to have that stomach put back in position and have her spleen removed. I'm going to take a look at her and see how she's doing. A good girl, hey? Look really good. Most animals that have the same problem as Molly take a few days to recover, and Molly overnight is looking so much better. She hasn't had any complications, that arrhythmia has resolved, and I think she's ready to go home. You go see Mum? Okay, let's go.
I'm really excited to be able to take Molly home tonight. Normally they need to stay in hospital for a lot longer than this, but she's a fighter, my dog.
Hey, baby. Oh, my meal. Hi. Hello. How are you?
I'm so relieved that Molly has pulled through. Knowing how severe this sort of situation can be, and the fact that she's pulled through is amazing. She's happy, she's bright, she looks incredible.
All right, so this is it.
Yay!
Bye, sweetheart. Hey, be a good girl for Mum. Hey? Oh, you're a lucky thing. When Bethany first brought Molly in here, she was absolutely devastated. She didn't even know if Molly was going to survive. And now she's taking her home and she must be over the moon. Bye.
Lisa, thank
See
you.
Pleasure.
Come on.
I'm pretty confident his problem is down here. Right next to where he got me a beauty, by the way.
In the Cook Islands, Chris's feisty patient Manny has his own war wounds after fighting with other ducks.
So I think that he's actually got an infection in there. In the fight, it's introduced some bacteria underneath the skin here.
Right.
And it does actually feel quite hot there.
When ducks fight, they scratch, and when they do that, they inject bacteria with their claws underneath the skin.
So I think what we need to do is give him some anti-inflammatories and some antibiotics. If we do that, then we'll treat the cause of the problem, but also treat his symptoms. So he'll walk a lot better, but in the long term, we'll be able to fix the problem as well.
Okay. That's what we need. Yeah.
It is.
I'm very glad Chris has treated Manny. I think with the antibiotics and anti-inflammatories, the duck will be a lot better and can probably fend for himself.
So I can give him his first dose now if you like. This is going to be tricky.
This is going to be tricky, real.
Manny will need to be on the prescribed medication for at least a few weeks. After this time, Chris is confident the young bird will make a full recovery.
I'm quite sure Manny's going to go home and tell all his mates how he beat up a vet from Bondi. And going on how I look right now, I don't blame him.
Oh, thanks, Chris.
No worries.
Lovely.
Good luck.
Later that day, Chris is making a house call to an unusual patient with a strange addiction.
Hello.
Oh, yeah. Hi, Chris.
How you going?
Hi.
Hey, nice
Erica.
to meet you.
Yeah, good to see you.
Now, a goat.
Yes, OK. Well, she's over here.
But it seems Brownie the goat isn't keen to meet this Brownie from Bondi.
There was a goat.
There was a goat. I think she's eaten it. We're going to have to go and look for her.
All right, let's have a look.
OK. OK.
This may be the most unique goat anywhere in the world because right now it's invisible. It's nowhere to be seen. So not her?
She's got a pink collar on this morning. I put one on her.
Okay. Brownie!
Come on, girl.
Brownie was close to death when Erica first found her. The tiny goat was severely malnourished, and the only thing Erica could convince her to eat was Turkish bread.
Unfortunately now, she's really obsessed with eating Turkish bread.
So we've got a bread addiction.
Yes, we have. Got a serious one, I'm afraid.
But no goat to go with it.
No goat yet. I think in the beginning, because she wasn't eating anything at all, it was the best I could do.
Brownie!
It was really, really bad. Just skin stretched over bone. That's all she was.
Brownie!
What concerns me now is that Brownie is a healthy goat and doesn't need to eat Turkish bread.
It's in those low trees. An addiction to eating Turkish bread, it may sound almost funny, but it can have quite fatal consequences. Goats running everywhere. My worry is that eating more than just, say, a slice of Turkish bread could cause a condition called lactic acidosis. It's also called grain poisoning, and in a lot of animals, it can be fatal.
Brownie!
That's her?
Come on, darling.
Finally, Brownie decides to come out of hiding.
Darling, I know there's strangers here. Come on, sweetheart.
Brownie, we've been looking for you.
Come on.
No bread, but, you know.
Yeah,
No
stranger
bread, no
danger.
interest.
Stranger danger. Come on, you better follow me.
Blends
Come on.
in. Okay, let's go.
Come on, darling.
Brownie is now being taken to Erica's house so Chris can see firsthand how this little goat is managing to feed her deadly addiction.
Brownie's definitely become a part of my life. Couldn't live without her. The thought that it could kill her defeats the whole object. And that would be dreadful, really would. Oh, sweetheart.
Let's go.
You're very brave.
At Sash, 8-month-old rescue dog Rogue is about to undergo surgery to remove her right eye and the mysterious mass growing underneath it. The delicate operation will be performed by ophthalmologist Dr. Alison Groth.
I guess what's complicating this case is the presence of this mass. Biggest concern is that it might be cancer, and if it is, whether the mass and the eye are related. Okay, getting rid of a source of pain is often a lot more important to a pet than the cosmetic implication of not having an eye anymore.
Alison is hoping that removing the eye will make the 8-month-old's life a lot more comfortable.
The eye is really not serving her any purpose whatsoever. All it's doing is acting as a potential source of problems. She doesn't respond to light at all, so she won't miss it in the slightest. Okay.
20 minutes later, and stage 1 of the operation is complete.
So that's the eye out, and now we'll stitch up. All right, now let's move on to this mass. I think that the lump's probably more of a concern to us. It might be cancer, and if it is, then there could be more serious issues.
A sample will be sent to the lab for testing. The pathology results should be back within a few days. It will be a nervous wait until then.
All right, that's it. It's done. I'm really happy with how it went. She's been a very good patient.
Let's go. Let's go, Brownie.
So this is where it all happens.
This is where it happens.
In the Cook Islands, Erica is hoping Chris can stop Brownie's deadly Turkish bred addiction.
Turkish bread seems benign enough, but what it is a really rich source of carbohydrates. And normally animals like goats eat grass, something that takes a lot of work to digest. All the energy in it, all the carbohydrate is very readily absorbed. The bacteria in their gut starts to process it, and suddenly they multiply because there's so much food. All those bacteria then cause a whole burst of acid to be released into the system, and that acid can kill the goat. Can I see what happens?
A breakfast session?
Yeah.
I've got 10 cats, and they have to all be fed in different places.
You've got quite an audience here.
Well, this lot, yeah.
3 cats and a goat
So far,
watching your every move.
She knows where my concentration's gone. She knows she's not supposed to steal out of the fridge where the Turkish bread is, but she waits for her moment. She's at this fridge already.
So she's seizing her moment there.
Totally. If I say to her, out of the fridge, and I close it, she knows that as soon as it's closed, if she gets there immediately, she can still pull it open.
So she gets her head in there and then steals it. The challenge is going to be making sure she stays out of that fridge, because you should still be able to have Turkish bread yourself.
I need to get in the fridge. Yeah, exactly. I like Turkish bread too, believe it or not. Yeah.
And you shouldn't have to buy a new fridge, so I'll leave that with you.
Okay.
And you leave this problem with me.
Brownie, you're just going to have to behave yourself. Brownie's very determined, so I'll be very interested to see what he comes up with. Oh no, come on, Brownie.
Hey, Rogue. How you going?
At Sash, it's been 24 hours since Rogue underwent surgery to remove her eye and the dangerous lump growing underneath it.
Rogue's recovered well from the surgery. She's looking fantastic. She's wagging her tail and she's definitely ready to go home. Should we go see Sonia? Hey? Should we go?
Foster mum Sonia is eagerly waiting for the brave rescue dog.
I've got 4 other dogs at home. They were all looking for her when I got home, so they were all a little bit down last night, and so was I. I was just hoping that she came through the surgery really well and, you know, she wasn't missing us.
Hey, where's Sonia? Where's Sonia? In there.
Hello. Hey, gorgeous. Oh, look at you. Oh, yes. Yes.
She's so excited to see you.
Yes.
So where the eye was is quite swollen now, and also where the lump was taken out, so that will settle down over the next week. Her hair will grow back over the area and no one will even notice.
Okay.
Okay.
And you're still just gorgeous anyway, aren't you,
She is
darling?
just as happy as she was before, so...
I'm hoping for Rogue now that obviously she heals up really well, she doesn't have any pain, any complications, and she'll find a really wonderful home.
We'll miss you, sweetie pie. You've been a delight to look after. Rogue is so happy to be going home with Sonia. She's wagging her tail. Now we need to just wait for the pathology results, and I'm really, really hoping that it doesn't come back as cancer.
Come on, let's go.
This is more like goat food.
In the Cook Islands, Chris is on the search for a cure for Brownie the goat's dangerous Turkish bred addiction.
And it's right there. It'll work. The way I see it, it's been Brownie's sense of taste that's got her into this mess. Hopefully it'll be her sense of smell that gets her out of it.
You going to be a good girl?
Erica knows that if this Turkish bred obsession isn't stopped, she risks losing her best buddy.
I feel dreadful that it could actually kill her. She needs to return to being a goat. Although we'll still love her, that's got to stop now.
Brownie, I hate to say it, from one Brownie to another. The game is up, my friend.
Come on, Browns.
It's time to fix this problem once and for all. Now, I considered putting a lock on the fridge.
Yeah.
Even a latch.
Okay.
That's going to be annoying for you because you can't just walk over, open the fridge, get things out.
Exactly.
And I know when you're feeding all those cats, it's absolute mayhem.
Yeah, yeah.
So I'm going to use something that takes away any interest Brownie has in opening the fridge in the first place.
Okay.
You ready for it?
Yeah.
It's a vapor rub.
Oh, she won't like the smell of that.
Exactly. So all we need to do is just get a fingerful.
Right.
And we just smear it at her height along the fridge door.
That's not so nice, is it, Brownie?
And now, I guarantee you,
she's not going to go there.
She's no longer interested in that fridge. We'll shake it out.
It doesn't like it. I'm actually blown away. I mean, vapor rub, who would have thought of that? This is so simple, this answer. I don't know why it hasn't been thought of before.
The big test is, with the door just sitting there and the bread is inside.
She's going to try and open the door now from the other side because that smells of eucalyptus. So she's hoping that the fridge is going to open this way.
Bit of goat optimism.
Yeah.
Yeah.
Well, I think, and she's going to work on that.
Anything's worth a go.
Yeah.
This will obviously stop her eating the bread and you'll have amazingly clear sinuses for months.
Yeah, it'd be great. Thank you. Fantastic. Right. And she won't get any colds. Thank you.
No worries at all.
Thanks so much.
Okay, take care.
All right. Bye.
See you soon. Oh, really? That's what you think?
Oh, no. Come on, Brownie. That is not gone. No, 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 no.
You always have to have the last laugh, don't you?
Come on, Brownie. That is not on. You know you're not allowed to do that in the house. Come on. I have to go and get a towel. Excuse me.
Cook Islands, full of surprises.
We're going to meet your new family. Yeah? Come on.
It's been 4 weeks since Rogue's operation, and foster carer Sonia has now found the brave wolfhound a brand new home.
Rogue's come along today to meet Amy, Ruth and little Theo. They're a lovely family. So fingers crossed, this is the home for her.
Say hello.
Hey, Kitten.
I'm Rogue.
Hello, Rogue.
Oh, she's so beautiful.
Look. Hey, Theo, look.
So gorgeous.
Look.
Do you think their tummy rubs are good enough?
Oh, good girl.
You like them, darling? Hey?
Oh, Rogue's beautiful. The minute I seen her, I just sort of fell in love, and yeah, she's definitely special.
Theo. Look. Oh.
And there's even more good news.
Rogue's lump came back non-cancerous, so that was very relieving. So everything's all good. Go.
The fact that Rogue's only got one eye doesn't seem to bother her at all. She's just getting around normally and will lead a happy life. Come on, Rogue. Good girl. Good girl.
You cheeky little thing.
Two intriguing animals, along with keeper Kylie from the Symbio Wildlife Park, have arrived at the Bondi Clinic.
So today we brought in Rex and Leo, which are two native Australian mammals. They're very important to us. Now the reason why we brought Rex and Leo in today is because one of them, Leo, has not been sexed. So we want to determine the sex because hopefully we can start to get into breeding next season.
Kylie.
Hi.
How are you?
Good.
Good to see you.
You too.
I'm a little anxious because I've got no idea what's in these boxes. And you have a place that's full of surprises, so...
We do.
Let's go through and let's work it out there. When I first see Kylie, she has this coy look on her face, almost bordering on smug. When she has that look on her face, it worries me. It means she knows whatever's in this box is going to surprise me. Which one's my patient?
The smaller one.
Small one. Intriguing. Wow.
Have you ever seen one like this before?
No. No, I have not. But look at you.
So this is Leo, and Leo is a very special echidna.
This is an albino echidna. Incredibly rare. You'd be lucky to see an albino echidna once in your lifetime. How did you end up having him in the first place?
Around 4 years ago, Leo was actually handed to us from members of the public. They found Leo in a car park in Berry as a little puggle, but Leo wasn't able to look after himself, so we took Leo in and finished off raising him, or her, and yeah, we've had Leo ever since.
So you need to know if Leo is Leo or Leone.
Yes. Yeah, so Leo is 4 this year, which means that she's becoming sexually mature. So it's the time that we should be able to determine what sex she is. And hopefully, once we determine the sex, we can look at breeding next season.
If you want to know if your echidna is Arthur or Martha, you have to wait until they're at least 4 years of age. By that stage, they've reached sexual maturity. They actually have those organs and they're a proper size. Until that point, there's no point even trying. Do you realise what you're asking of me? Sexing echidnas is notoriously difficult.
Yes, it is.
Because they only have one hole, and what's inside that hole, they like to keep a mystery.
Yes, they do.
Yeah, okay. Kylie has set me a real challenge. This is not going to be easy.
Sasha, come on, sit down, it's okay.
Sasha has been rushed into the Bondi Referral Hospital SASH after mysteriously developing a badly swollen stomach.
I was just working in the garden and I saw her drinking some water and I saw at the tummy bloated out. Then she started burping and I thought, that's not a good sign, so we made our way here.
Owners Susan and Alan are extremely worried about their special girl.
We rescued her from death row. She had less than 24 hours to live and we were going to find her a home and we kind of fell for her and decided we had to keep her. She's gooby eyes all over this one.
Hello, I'm Lisa.
Hi,
This
Lisa.
must be Sasha.
Yes.
Hi, nice to meet you. Hello, Sasha. All right, what's going on with her?
Basically, about an hour ago, I noticed that her tummy was quite bloated.
Okay.
We've got another Roddy at home, so we felt her tummy and it was soft and normal, and hers was rock hard and swollen.
Hey, Sasha, let's take a look at you, honey. Okay. There are so many conditions that can cause a dog's abdomen to become enlarged, and unfortunately, a lot of them don't have very good outcomes. I just hope that Sasha's got something we can treat. All right, can you stand her up for me?
Okay, Sasha, stand up. There's a good girl. Stand.
Good girl, darling. Standing up.
Come on, stand up.
Good girl.
Relax.
Yeah.
It's all right, Sash. Come on.
You're quite sore in there, honey. I'm feeling her abdomen and it definitely feels enlarged. She definitely is showing signs of a dog that has got a condition called bloat.
Bloat happens when a dog's stomach fills with air, fluid or food. The dog's swollen stomach can twist, cutting off vital blood supply to organs.
All right, so The next step is to get an x-ray of her. She is feeling quite bloated. Are you okay if I just take her out now and take an x-ray and then I'll be able to give you some more information?
Okay.
Come on, Sash.
Good girl,
Let's
Sash.
go. If Sasha has got bloat, or worst case, a twisted stomach, that could be life-threatening. We've got to move really fast, get these x-rays done and try and work out what's going on.
Surprise, she's popped an egg.
Hey, look at that. How long's that been there?
I know, I wasn't there yesterday.
Well, well.
At the Australian Reptile Park, General Manager Tim Faulkner is checking out a commotion in the Cassowary enclosure.
Cassowaries are really cryptic birds and not much is known about them in the wild or in captivity. So when an egg turns up in a yard, it's a bit of a surprise to say the least.
Tim knows the egg will be infertile.
Cassowaries are the same as chickens. Unless they've mated with the male, the egg is infertile. It has a yolk, white, but no little chick will ever grow.
But the egg is a promising sign.
We've had the female for 5 years. First egg she's ever laid.
This proud girl is ready to mate.
And how's she?
Mate, she's prancing around. She's making herself nice and big.
First things first, let's go in and let's find out what she's going to do. I think she's going to be cranky.
I think she's going to be cranky too.
Settle down. Hey, settle down. Not only cassowaries arguably the world's most dangerous bird, but they recognise the uniform and they hate us. Every time you enter a cassowary yard, it's potentially dangerous. Their feet and those claws can rip you apart. Oh, settle down, big girl.
So no little hints. I mean, he's not watching a lot of car racing or, you know, interested in...
She's keeping a secret for now.
Okay.
Yeah, very well hidden.
At the Bondi Clinic, Kylie is hoping Chris can determine the gender of little Echidna, Leo.
Echidnas are monotremes. Basically, everything that's sexual about them is kept inside, all their organs. So simply by looking from the outside, it's almost impossible to tell. Could we actually get Rex out?
That we can.
Wow, she's a lot bigger.
She's a heavy little thing.
So we know that Rex there is a girl.
Yes, Rex is a female.
This is actually perfect. I mean, now I can see if there are any similarities or any differences. Hopefully then we'll have our answer. Males tend to have the spurs, females tend not to, but you can have females that do have spurs as well.
So typically males do have spurs on the inside of their hind legs, but there is a percentage of females that have been found to have spurs, and there's also a percentage of males that have been found not to have spurs.
There's actually a tiny little spine there.
Yep.
But as we know, it's no guarantee.
Rex doesn't have any.
On size, what about the size comparison of the two of them? Females are meant to be bigger.
Typically, yes.
But Rex is a bit older.
Yes.
Leo.
Yeah.
So we're getting a few little clues, but not really leading us one way or the other.
No.
We're a little bit stuck.
Yes.
The only one in this room that knows the truth is Leo. And Leo's not saying anything. There is a little technique I have in my arsenal that's, well, a little bit special and can sometimes give you a bit of a clue as to whether Leo is male or female, but I don't bring it out just willy-nilly. You'll see why. You know, if you tickle their belly, sometimes they can let you know exactly what they think of the
belly rub.
Tickle?
Yep.
I want to point out that my hand is quite high in his stomach region and no other spot. He's grabbing my hand too. Is that the spot? Is it? Huh?
Although Chris is doing a really good job at tickling Leo, I think that maybe Chris isn't Leo's type.
Clearly Leo has some stage fright or is just unable to make an appearance, if you know what I mean. We're still no closer to knowing whether Leo is male or female, so it's going to take an anaesthetic to find out.
Look at her, look. Oh, yeah. She's presenting to him.
At the Australian Reptile Park, the female cassowary is suddenly putting on a rare display.
Look at that.
Look at that.
Look at that. now is trying to be mated. Look at this. Look, these two cassowaries, male and female, live next to each other, separated by a fence. She's laid an egg, which means she's reproductively active. It's her first egg ever. We need to have a look at that egg, check the yard out, and then let them do their thing. Put them in together, stand back and observe. We have to get in. Of all the animals in the park, she's one of the most dangerous. Even though she's standing still, they go from 0 to 100 in a second.
Despite the danger, Tim and his team need to get a close look at the egg.
Watch your back on that fence, boys. Watch your back on that fence.
But the male is now also hovering dangerously close.
Hey, look at this. Look to the left. Look, 4 eggs. Look at that. So this one's rolled out. We enter the enclosure, walk down to where the egg's laying. Straight away you can see there's another 4 eggs to the left in a nest. Yeah, don't let her around that backside, boys. I don't want to be cut off, please. Maybe she's laid it there and hasn't rolled it in, or maybe she laid it here and it's rolled out.
The surprise haul confirms the female is definitely ready for mating.
Look at that. She's just done something amazing. She's gone and sat down near the male and she wants him to mate with her. She's soliciting the male to come and mate. We'll get on out and let the male in.
Pop you up on the table. You're such a good girl.
At Sash, 8-year-old Rottweiler Sasha is about to have an X-ray to determine whether she's suffering from a life-threatening condition called bloat.
You're a lovely girl. You're okay. We just need to get a picture of your tummy. Good girl, honey. When a dog has a bloated stomach, we've got to move pretty quickly because we never know if the stomach is twisted or not. And if that stomach is twisted, Sasha's life is in jeopardy.
Owners Susan and Alan are agonising over what could be wrong with their precious girl.
I think she's actually in a lot of discomfort. She wasn't happy in the car. She wouldn't sit down. She wouldn't lie on her tummy. She's definitely not right.
Oh, her stomach is huge. Now, from these x-rays, it doesn't look like it's twisted, but it's definitely dilated. A normal stomach should be about this big, and Sasha's stomach is probably 3 or 4 times the size that it should be.
Lisa is now certain that Sasha is suffering from the potentially deadly bloat.
My worry is that if we leave it as is, her stomach could twist, which can basically cut off the blood supply to vital organs, cause the dog to go into shock, and they can die within a few hours.
Life-saving treatment needs to begin immediately.
You're a good girl, Sasha. We're going to get this pressure down, I hope. I'm going to pass this big tube down Sasha's stomach to try and relieve that pressure that's in her abdomen. Now, if I can't decompress her stomach, then she's going to have to be wheeled straight into surgery. All right, let's see if we can pass the stomach tube. It's going in.
As the tube enters Sasha's stomach, there should be a rush of air and fluid.
Oh, should be in. I'm not really relieving any blockage.
But after more than 15 minutes, Lisa is unable to alleviate Sasha's bloating.
We're really racing the clock here because the longer that Sasha's stomach is bloated, the higher the risk that it could twist and she'll end up in surgery. We've got to move fast.
Oh my God. Oh my God. What is with the colour?
Yeah, he's an albino, or she's an albino.
He or she?
Yeah, exactly. That's why Leo's here. It's a big day in its life.
Hello.
At the Bondi Clinic, Leo is about to be anaesthetised, so Chris can try to figure out if the little echidna is a male or a female.
So, I know that we usually use something like this, but
may be problematic.
yeah, this isn't a good fit, so we're actually going to need to make a mask for an echidna. Give me a syringe, some tape and some tubing, and I reckon I can make you an Echidna anaesthetic mask. There we go, that's more like it. All right, shall we start?
Let's do it.
Leo's keeper Kylie is keen to find out what Chris will discover.
So I am quite confident that we'll be able to determine the sex accurately with Leo today, being that we are in breeding season. So typically the best time to sex an echidna is in breeding season when their organs are ready to go. So fingers crossed.
Leo's going to go to sleep in a world of pink, possibly wake up in a world of blue, or pink. So we do need to get Leo quite deep with this. We'll get Leo to his back here. So you happy there?
Yeah, he's good at the moment.
All right, so what we're looking for is a little bulge in front of his or her cloaca here. So if we look here, we can see that the leg bone, so femur, coming up here. Now what we should be seeing if Leo's a male is a little bulge here, and I'm really not. So at the moment we're leaning more towards female. Actually feel something that is tucked away. You see that? You're seeing the unmistakable echidna penis.
It's the weirdest looking thing I've ever seen.
There is no doubt that Leo is a boy. I think we should tell Kylie. I think you should see this.
Wow.
Yeah.
It's definitely a boy.
Yeah. Not just an albino, but an albino male.
Wow, that's very exciting. Looking at Kylie, it's clear she's absolutely stoked. Now that we know Leo is a boy, she's going to be able to find him the perfect partner, and together they'll be able to breed. So we'll wake him up and we'll deliver the news to Leo himself. Himself, as opposed to herself.
Okay.
He looks so sweet.
Well, now we know, huh? Yep. A little high five. Thank you. All right. Yep. Brothers. Good work, Leo. You want to go home now? Okay. Leo is clearly a man, very clearly, and we're bonded in a very close way. But now it's time for Leo to go home. Is there like a welcome home Leo party planned?
Not yet, but I'm sure we can organise one.
A whole lot of masculine activities. So there you go.
Thank you for that. You did very well. I might have another challenge for you, something else a little bit different.
What is it?
We've got a female Sumatran tiger.
Of course you do.
Which needs a procedure, if you're up for it.
Tiger.
Yes.
Just when I thought my day couldn't get any weirder, Kylie's now invited me to Symbio to help out another patient. Let's see what she's got in store. I'm not going to say no to a tiger.
Yeah?
Yeah, let's do it. All right, I'll give you a hand.
You're a good girl, Sasha. We're gonna get this pressure down, I hope.
Sasha is in serious trouble. She has a dangerous stomach condition called bloat. If Lisa can't remove the build-up of gas in the Rottweiler's abdomen, the 8-year-old will have to go under the knife.
We're in her stomach now, but I'm not really getting anything back. I'm not decompressing her in any way, so we're going to just try and put her on her back and see if a different position will help.
But moving the Rottweiler is incredibly risky.
Us moving her like this could actually cause her stomach to twist, but I don't really have another option. I've got the tube in her stomach and I need to try and get that gas out. Come on, Sasha. Hey, Sash, all I've got to do is get this gas out from you. Oh yeah, I got something. Good girl. At least I've got a bit of food in there now. Finally, I think that we've had some progress. We moved Sasha into a slightly different position and I heard a sound of gas, but I need to take an X-ray to know for sure. Ah, that is a huge relief. Her stomach is about 1/3 of the size that it was. But she's a big dog, and I'm worried that she'll bloat again. And if that happens, her stomach could twist, and that can be life-threatening. Now, the only way to prevent it from twisting is for her to have surgery.
How'd they go on the trip?
Good.
Chris and Kylie have now arrived at Symbio Wildlife Park just south of Sydney with echidnas Leo and Rex.
Okay, guys. Home time. Get them out?
Leo, a little albino echidna, has just been sexed as a male and hopefully will go on to breed.
Is it just me, or does Leo have an extra spring in his step now that he's a new man?
I think so.
With Leo and Rex now happily back in their enclosure, Chris has a much bigger patient to see.
I've been asked to come here today to help them with a procedure that could be simple or could be very tricky. We're hoping to put a contraceptive implant into one of their Sumatran tigers, Sinta. So who's this one here?
This is our boy Jalua.
So this is our patient's brother.
Patient's brother, yes.
And let me guess, the fact that they're brother and sister is the reason they need the contraception.
Yes, they're both 6 years of age, so they are sexually mature. So because they are siblings, we need to make sure that Sinta remains up to date with her contraceptive implant.
The important thing about Sinta is she is a breeding female, but she's in an enclosure with her brother. So we need to make sure those genes don't combine together, otherwise there's a serious risk of birth defects. So she is currently tucked away?
Yes, so she's away in her den facility at the moment, because that's where we'll be doing the procedure.
With Sinta already locked away in her den, in many respects the clock is already ticking. Because the longer she's kept in that den, the more stress she builds up, and that stress is going to be the enemy. It'll send her body temperature sky high. We have to get moving right now.
This is Dr. Michael Cannon.
How are you, Mike?
Chris, how are you?
It's good to see you again.
Good to see you again as well.
Mike used to be one of my lecturers at uni. I wasn't exactly the best student. I'm just hoping he doesn't remember that.
The pressure is on Chris and Mike.
Sinta is such an important part of my life. When we first worked with her, she was such a sensitive little girl, and she's someone that we really had to work hard to create a bond, so it's just made the bond that we have just so much more worthwhile, just all the effort that we've put in just getting that relationship built up. I'm going to leave it to you guys to head in there. So once she's darted, if you could just let us know, and then once you're ready for us to come on through, just radio and let us know as well.
Let's do it. Kylie's gone to the other end of the enclosure with good reason. For Kylie, her relationship with Sinta is critical. Everything they do on a day-to-day basis hinges on there being trust. If Sinta in any way associates Kylie with this dart, then that bond is broken and could be broken for life.
You all right, Sash? Time to go? Get you sorted?
8-year-old bloat patient Sasha is about to undergo a procedure called a gastropexy. Her owners have given specialist surgeon Andrew Marchevsky the go-ahead to perform the operation.
Dogs like Sasha, when they've had a bloat, almost certainly they will bloat again. And if they bloat again, they'll almost certainly twist. And if they twist, they die. So if we can do this surgery, we can save it from that fate.
Righto, let's go.
Andrew will perform Sasha's surgery laparoscopically. Through small incisions, he plans to stitch Sasha's stomach to the wall of her abdomen. This will prevent it from twisting.
The major risk with keyhole surgery is that you're actually entering her tummy or her abdomen blindly. So if we're not incredibly careful, we can actually puncture major organs like a spleen or a liver, and then we get lots of blood. So you do have to be really careful. So we're just going to put a scope in, and that's the keyhole part of this. So we'll actually be able to see inside the abdomen and see all the organs in there, and then we'll be able to grab the stomach. So I've got the scope in now, and I can actually see all of her abdomen, and I can actually see her stomach. Now just got to find the right part, which can be easier said than done.
Only a handful of laparoscopes have been performed at Sash, so everyone is keen to follow Sasha's progress.
She's one of the first dogs here to have this kind of procedure done through a tiny little incision, which means that her recovery is going to be really fast.
Yeah, that's good. That's good. We've just identified the part of the stomach that we need to suture or stitch. So I've just grasped that now and I'm going to bring it up to the abdominal wall and suture it in place. That looks really nice. I'm very happy with that. All right, that's good. So you can see there, just on the bottom is the stomach and the top is the abdominal wall, and you can see that they're now attached. So that even if she does bloat again, she can never twist. And as I've said before, it's the twist that's really life-threatening. So we'll make her life much safer.
Finally, Sasha's life-saving surgery is finished.
I'm really happy with how it's all gone. You know, we didn't do any damage to the spleen. Surgery's gone really smoothly. And I think, best of all, Sasha's going to wake up really comfortably, and that's really what it's all about.
It's easy, girl. It's all right, Cinta.
At the Symbio Wildlife Park south of Sydney, Chris is about to sedate Sumatran tiger Cinta.
The reason why we're darting Cinta is because she is a dangerous animal, so it is something that we do need a veterinarian to come in so everything's safe and the procedure can be carried out safely for both Cinta and us.
Cinta needs a contraceptive implant, but the wily 6-year-old knows something's up.
It's easy, girl. It's all right, Cinta. The biggest concern when you're using a dart is the fact that you could actually lodge that dart in the wrong place. If I was to hit her abdomen with the dart, I could rupture an organ and ultimately kill her.
There is periods of silence, which we're hoping that they're able to dart her if she's giving them an option, but I'm feeling very anxious, very nervous at the moment.
There we go.
If you think you can take the shot, have a go.
Now we're confident that the dart is in. The important thing right now is assessing just how deep under anaesthetic Cinta is. If she has had some anaesthetic but not quite enough, there is a chance she could be asleep, but the moment we touch her, she could wake up. If she does that, everyone's in danger.
Okay, he's coming, guys.
At the Australian Reptile Park, it's time for the eager young male cassowary to be introduced to his feisty female neighbour.
Keep it there, Mike. Just push him back a bit, mate. Push him back a little bit. Just watch out. His aggression could go through the roof right now.
Tim and his team are on high alert.
Get ready here, because when they start running, they're going to run really fast and not pay attention to us. So just get ready for that. Okay, that's far enough for us, boys. So let's just hold a line here. Breeding cassowaries in captivity and knowing how to breed cassowaries in captivity is now critical. There are less than 1,000 cassowaries in the wild, and that number is steadily decreasing. If the cassowaries were reliant upon the captive population for their survival, at this point in time, we don't know enough. We're not very good at it, but we're learning. And exercises like this and successful matings mean we know how to do it, and if we need to secure the species in captivity, we can.
Tim is anxious to see this pair succeed, but so far it hasn't exactly been love at first sight.
Mate, just watch her. She's up on her toes. I can see how revved up she is.
Last time this exact pair were introduced, the male got the female into a corner. He's almost half her size, and he just kicked 1, 2, 3, 4. Hey, settle down, you. We had to get in. Break it up, separate the cassowaries, and that's terrifying, and then push the male back into a separate yard. Okay, now he's here. Let's back up a bit. Let's give him a bit of space, boys. Yep, quick mark.
This time, Tim and the team are poised and ready to intervene at the slightest sign of aggression.
This could still turn into a fight. The signs here are really encouraging, but last time, And times before, I thought things were going well, and it very quickly turned nasty. The mating's interesting, but if we see a fight, we're in there and we're separating.
The challenge here is that she's actually facing away from us, so we can't see a lot of her face. But if I just use this high-tech pole, quite ticklish around the ears there.
At the Symbio Wildlife Park, Chris and the veterinary team have just sedated Cinta.
You see there's not much response there. It's a good sign that she is quite deep.
Chris has to give the Sumatran tiger a contraceptive implant, but before the team can enter her enclosure, they need to make absolutely sure she's fully asleep.
So we're getting some really positive signs right now that she is deep enough. We're getting a slowing down of the breathing, and also there's no response when I tickle her around her ears or her nose, so we're pretty confident she is deep enough for us to approach.
The medical team can now enter Cinta's compound.
We've got anywhere from between 5 minutes to half an hour. So fairly fixed pupils there. Okay. When the time's up though, the time's up. Yeah, we just need to get this front leg here. Oh, just hang on. Okay. She's got a bit of weight behind her, doesn't she? Yeah, 90 kilos.
Any animal that goes under anaesthetic, of course, there's always risks. When you're doing it with a big cat, there's risk both for the animal and also for the staff involved as well. So extremely anxious, anything could go wrong at any time.
The main point of today is to give her a contraceptive implant here. So this is just almost like a little bead that goes underneath the skin that slowly releases a hormone over the course of 12 months, which will ultimately suppress her from breeding. And we're gonna get under the skin here. Okay, that's in.
The implant procedure takes just seconds. Chris and Mike now need to carry out a full physical.
Mike and I know that time is incredibly short here, so we're going to split our resources. Working from the back, it's clear that she's in good condition. She's got a nice mix of muscle and a body fat. How are those teeth there, Mike?
They're excellent. They're getting enough bones that are wearing it. There's no tartar forming there. There's no gingival recession. It looks good.
Very impressive.
Yes,
but
they
very
are.
clean as well.
Absolutely.
Next is time to check Cinta's heart. Mike passes me the stethoscope, and very quickly I can hear her heart, big and booming. It sounds good. But all of a sudden...
She's starting to wake up.
Okay, her heart rate has just quickened just a little bit too.
Yes.
She's got a little blink there.
Yes, she's responding.
The team is now at serious risk.
So she's starting to swallow. Okay. All right, if we can start moving stuff out.
Cinta is essentially in the twilight zone. She's not fully under anaesthetic, but she's not fully awake. At this stage, they're probably more dangerous than at any other time. We have to get moving right now. Okay, everyone out.
Yeah, she's taking him for a walk now.
He's picked up the pace now and he's right on her tail. Good signs. Here he comes.
At the Australian Reptile Park, Tim and his team are anxiously watching a pair of cassowaries, hoping they can mate safely without a fight.
Last time, at about the 15-minute mark, we had a kickboxing match on and we had to separate. That's a boy. All's calm.
Despite their history of aggression, their courtship seems to be going smoothly.
Not a lot's known about cassowaries, and in particular, their mating ritual, but what we do know is that the female solicits the male. She'll begin to walk, fluff her behind up, and indicate that she wants to be mated with. She's twice his size, it's no wonder he's a little intimidated.
As the birds circle each other warily, the keepers can't let their guard down.
Cassowaries don't get the reputation of being the world's most dangerous bird for no reason. This could still go pear-shaped, so essentially, we never relax in this situation.
We've left them in there, and it's going well. They're both calm, and they're courting. So the female is leading the male around, and he's now hot on her heels. He's zigzagging behind her.
Suddenly, the female makes her move.
She's gonna do it.
The female cassowary has stopped her prancing and is sitting. It's an open invitation for the male to begin mating.
That's exactly what we're after. They're mating right now. That's the male on top. And the female's just gone and sat down. First time I've ever seen it this close. And a far cry from last time's fight. And it's amazing how such an aggressive bird can be so gentle. And now he's preening her. I'm so happy with how today went. There was Mike, Nick, Obi and I, and for all of us, as keepers, we love our animals. And to see that is something we've never seen before, may not see again.
Okay, everyone out.
At Symbio Wildlife Park, Cinta the Sumatran tiger has begun to regain consciousness during a medical procedure.
Are we happy? Yeah? Very quick on that little eye response there, the blink and then the swallow, Molly. So the procedure's gone well, but from now on it's not so much about our safety, it's all about hers. We need to ensure that she comes out of the anaesthetic fully and in a very calm and controlled way.
With Cinta slowly becoming more alert, it's important for keeper Kylie to leave the enclosure.
My role is to step away from the situation. As she starts to wake up, I don't want her to see me and associating me with the vets and everything that has just happened, so I remove myself from everything that's happening.
Easy girl, easy Cinta. There we go. As a vet, you use a few landmarks to say, you know what, they are going to be okay after this anaesthetic. One important one is lifting the head, and Cinta's just done that. Okay, she's looking relaxed.
She's looking well.
Better go and talk to the one that's probably not so relaxed.
Yes,
Kylie.
I think Kylie will really want to know what's going on. I'm extremely happy. I don't think it could have gone any better. Chris did a great job, a fantastic job.
Here we go, slides up. Okay, we're out.
A few hours later, and Cinta is back in her enclosure with brother Jalua.
Here she goes.
Little girl, she's doing well.
So that must be nice for you to see. Not only did she handle the procedure really well, but she's now eating.
Yes.
Can you relax now?
Yes, it's a huge relief. Very good to see her as normal, yeah.
And one day, maybe, she might be part of that breeding program?
Absolutely, yeah, she will be, just when a suitable partner comes about. That'll be really good to see her. She'll be a good mum. Overall, the procedure went really well today. Chris was fantastic. She got a clear bill of health. She had her implant, her vaccinations. She's happy, everything's safe. It went really well.
Oh, well, it's been a pleasure, so thank you.
No, thank you.
Hey, Sasha. You look much better. Hey, surgery went well and you've only got some tiny little holes.
At Sash, it's been just 24 hours since the life-saving surgery to stop Sasha's stomach from twisting.
Good girl. You look great. Because Sasha had keyhole surgery done, her recovery's been really fast and she's ready to go home. She's comfortable, her stomach is no longer bloated and her owners are going to be over the moon.
Devoted owner Alan is anxiously waiting to see his girl.
So we've obviously been really missing Sasha at home, my wife and I, but also we have 2 other dogs that are missing her too.
Hey,
Sasha. Sasha. Hello, darling. Hi. How are you doing?
As soon as Alan sees Sasha, you can tell just how much he loves her. He'll do anything for her, and finally, he's getting his little girl back home.
Now you can have a bit of peace of mind that if her stomach does bloat and you're not there, at least it's not going to be able to twist. So you've essentially saved her life by doing this surgery. She's a lucky girl.
We're looking forward to having her at home and settling down. The other dogs have been looking around for her, wondering where she is when her name's mentioned. So it'd be good to get her home.
Gonna go home? Hey?
Here we go.
Good girl.
All right then. Thank you very much.
No problem at all. You've done a wonderful thing. 48 hours ago, Sasha came in here with a really serious condition, and she has been so brave. I'm so glad that it's a happy ending for such a special girl.
Good girl, Sash. Come on then, let's go home. Let's go home. Good girl.
Hey, how you doing?
Got another appointment with Dr. Chris.
Okay, what we've got here?
I've got Scarlett with her little kitten.
At the Bondi Clinic, Scarlett is fiercely guarding her 3-day-old kittens.
Hey, sweetie. So tired, fix that little leg, huh?
Owner Wendy and her family have grave concerns about one of the little girl kittens, Amari.
Normally in a vet clinic, the earliest you ever see a cat is at around 6 or maybe even 8 weeks of age. To see these little kittens so young, it's very much out of the ordinary. So, what's happened? Because these guys have only just been born, haven't they?
Yes, they have. One was the last one that came out. She's come out with a twisted leg, which I'm really concerned about.
When Wendy first brings this kitten out, I look at its legs and straight away know whatever it has, it's serious. That's a very rare thing to see in a kitten, just to have that leg twisted and hanging like that. Essentially, if you look at this leg here, at the base, it bends up, which is kind of like her ankle joint.
Yeah.
And here, it goes the opposite way.
Yeah.
The clearest way of putting it is that if Amari was a person, she'd be able to bend her foot right around and actually scratch the back of her calf muscle with her toes. That's pretty scary. But she was born this way, wasn't she?
Yes, that's right.
Yeah.
I had tears streaming down my eyes looking at her.
People have told you that she should be put down?
Quite a few vets around my area said you should euthanize her straight away. I refused to because I love the cats. No, I'll do no matter what to save her.
I'll do what I can. I mean, it's obviously a pretty dramatic issue that she has.
Yeah.
Headed to Bundaberg in Queensland, and there's a scene that plays out here that's been happening since dinosaurs roamed the earth. And one of my ranger mates gave me a call and she said, "You got to get up here now." So that's where I'm headed, because this is something I don't want to miss.
Tim Faulkner has been called away from the Australian Reptile Park to witness an exciting event.
G'day.
Hey, Tim.
How are ya?
Good. Great you come to Monrepo.
Oh, it's nice to be here.
Yeah, it's a busy time here. We've got turtles galore, so we're at the moment nesting and hatching turtles. Judging by all of our visitors that we get here, we get people that come back over and over again, so I think Tim's going to think it's a pretty special place.
Where are we going to head?
I reckon we'll go up north.
Yeah?
And have a bit of patrol.
Okay.
Yeah?
This was an opportunity that was too good to pass up. Loggerheads in the wild face a lot of threats. There's longline fishing. There's plastic objects, bags and hard bits of plastic they swallow and kill them.
It's a very good incubating beach. We get really good hatchling success.
Yep.
And most of the turtles come up into that first grassed area to lay their eggs.
Oh, do they? So they're not going up over the top?
No, loggerheads usually stay on this bottom, yeah.
It's not long before Tim spots a tantalising clue about what's going to happen.
An eggshell. A little turtle's hatched from that. And that's tangible evidence that there are babies under here. I haven't seen any signs of life yet, but I know they're here.
Now it's a waiting game.
The sun needs to drop. We sit tight, wait for a turtle to walk up on the beach, or little turtles to scurry down the beach. Either way, I'm excited.
At the Bondi Clinic, Chris is trying to examine baby kitten Amari under the watchful eye of Mum Scarlett.
Is this okay by you, Mum? You're going to take it back, aren't you? No? It's all right.
Good girl, Scarlett.
The tiny 3-day-old kitten was born with a severely deformed back leg.
In all honesty, my big concern at the moment is looking at that leg, maybe it's just the tip of the iceberg. What I want to do is have a look over her right now and just check there are no other little problems, because quite often if you have a deformity, you can have other issues there as well. We'll just have a look on the roof of her mouth, just to check there are no holes there. A classic location for a genetic abnormality is a cleft palate, so it's important to look inside the mouth. It's actually pretty smooth in there. Yeah. Let me just have a little listen to her chest. Thankfully though, listening to Amari's heart, the beats sound clear and crisp. There's one thing we don't need to check, and that's her little voice box. That is fine.
Yes, that's good.
It's working perfectly, isn't it? After doing a full physical examination on Amari, I'm more confident that what we're looking at isn't a genetic abnormality, but I can't be sure. The only way to be sure is with an X-ray. We'll be back, and then I can work out a plan.
Yep, excellent. Let's cross our fingers, eh? Basically, every vet says that she's got no hope, so I'm really hoping Dr. Chris has an answer for me, and we can save Amari's life.
Wow, you can see the line here. This
Okay,
is our
so we got a track.
Yeah, exciting.
At Monrepo Beach in Queensland, Tim and Ranger Kathy are seeing the first signs that egg-laying loggerhead turtles are nearby.
If you look at the flipper marks, you can see they're across like this from each other. So
Yes.
that's a loggerhead turtle. They come up the beach using their front
So you
flippers.
can
one over
identify
other.
the species by the tracks?
Yeah, yeah.
All we need to do now is follow those tracks and we find a turtle. Hey, look at this. Look to the left. Look at that. That's a loggerhead?
That is a loggerhead turtle.
That's exactly what we're after. First time I've ever seen it this close. This is a loggerhead turtle, and it's pretty easy to see why they have that name. Their head is huge, and those flippers that are so designed for swimming turn into shovels.
So she's moving all 4 flippers. She digs about an arm length down, and it's about 2 handspans wide at the bottom, comes up to about 1 at the top.
We picture turtles being these slow, cruisy creatures, but you're talking 15 minutes to dig a hole, not 15 hours.
No, that's right.
It's a quick process. She's finished the hole, and then she rests her flipper up, and you can just sense that something's about to happen. 1 egg drops, 2 egg drops, 3, 4, 5, and soon enough, there's 20 to 30 eggs in the bottom of that chamber.
So we'll see if she's got tags, then we'll know if she's been here before.
It's an awesome spectacle that attracts visitors from around the world. But Tim and Kathy are here to carry out vital research.
Yeah, so she has got a tag, so we know that she's been here before. She's done a couple of breeding seasons.
Yep.
So yeah, it's great to see her back for another one.
Wonderful. Now we know who she is, it's time to have a look at the rest of the body. Okay.
What did we get? 99.8, I think.
Yep.
Yeah, average for our loggerhead girls.
Now the mum has to make sure her precious eggs are protected from predators.
So you can see all this sand she's dug out, so she's going to fill in over her nest, so it's nice and safe.
She's laid her eggs, the job's done, and now she's making her way back to the ocean, and pretty quick too.
But there's still a long night ahead, and Tim is desperately hoping the timing is right to see the next stage in the life of these extraordinary turtles.
What's happening there?
Oh look, Tim, we're in luck.
Look at that. Holy moly.
At the Bondi Clinic, Chris needs to x-ray tiny, squirming 3-day-old Amari.
She's going to keep on crawling away. Okay, so this doesn't look great, but it's often the best way to keep a kitten that's moving from giving us a blurry image on an x-ray. I'm sorry, Amari, this is not what you want, but yes, I've taped you down now. My real hope is that Amari's problem is purely as a result of her being in the womb and being compressed up one end and never having a chance to really stretch that leg out. X-ray. The X-ray will tell me though if this problem is actually the cause of a serious bone deformity. If that's the case, this issue will not be easy to fix. So you can see this is the normal leg here, and that's the femur coming down to the tibia and fibula. But when we go to the problem leg, we go femur, tibia, fibula, but then it takes this massive deviation out to the side. We've got tendons, we've got ligaments, we've got muscles that have tightened up and twisted and essentially locked that leg into the wrong position.
You're a good girl.
Owner Wendy is anxiously waiting to hear what Chris has discovered.
It'll be heartbreaking to see a bad outcome. I'm really hoping for a good outcome.
So I've had a good look at the x-rays. So what we're dealing with is a purely soft tissue problem. So it is something that's just in the tendons, in the ligaments, in the muscles.
Yeah.
What we're looking at is something that has probably occurred during her pregnancy.
Yeah, so she's been squished up or so forth at the beginning, her not be able to stretch out.
Yeah, so she's got essentially what we call twisted leg syndrome.
Yep.
It's very rare. It occurs in very few kittens, but when it does happen, thankfully, there is something you can do about it. From what I can tell in the x-rays, she's got all the parts for her leg she needs to be normal.
You've made my day already.
When this kitten was born just a few days ago, everyone said, put it down. There's no reason for it to live. Yet she looked at them and said, no, I'm going to make sure this kitten gets a chance. No, you may have saved her life. She clearly sees something in this kitten and sees some sort of hope. My job now is to try to turn that hope into a reality.
What have you got there?
An injured echidna.
Oh, okay, all right. If you'd like to take a seat, I'll let Lisa know that you're here and she'll come out and have a look.
Okay, great, thank you.
Eddie the echidna has been rushed into the Bondi Referral Hospital, Sash, after being rescued from the wine cellar of a suburban home.
He was removed from the house, and when I took him out, I noticed some blood on my leather gloves, and that's why I brought him here so he can have a checkup by a vet.
Hi, I'm Lisa.
I'm Susie.
Oh, beautiful echidna.
Yeah.
All right, bring him through. I can't remember the last time I treated an echidna. It's not very common that they come in here to Sash, so this is going to be a challenge. Okay, so let's get him out.
Oh.
Yeah, he's bleeding from the nose.
Oh.
I can see blood coming from Eddie's beak and my heart just drops. I'm really worried that this guy has got some serious injuries. He's got a bit of blood on his claws, but I think that's come from his beak.
Okay.
There is a chance that he's got some fractures there.
It's really distressing to see an animal bleeding, and just a little guy like that, yeah, I just want him to be okay to go back out. So do you think it's likely to be superficial? Or?
It's hard to know. The only way that we'll be able to tell is to actually take an x-ray of him. And the only way we'll be able to get a good x-ray of him is to give him an anaesthetic. Eddie has potentially damaged one of the most important parts of his body. Now, if he has a broken beak and we can't repair it, he's not going to have any chance of survival.
Okay, chicken. Good girl.
At the Bondi Clinic, Chris is starting treatment on little Amari's badly deformed leg.
So she may only be 3 days old, but what she's going to get is a pretty intense physical workout.
It's okay. It's okay, darling.
Kitten physio may sound a little strange, but it is exactly what Amari needs if she's going to be any chance of correcting the position of this leg.
If Chris can't straighten the leg, the tiny Tonkinese kitten may never be able to walk properly.
So our first goal is to get that leg straight. So if we straighten it out
Pull
there.
it out.
Okay, we let it go. At the root of this problem is the fact that the tendons that are actually meant to be loose enough to allow Amari's ankle to function normally, they're simply too tight. They're pulling that foot right back around. So we push to the point of resistance, which is right there, and we just hold it there for 10 seconds.
Devoted owner Wendy will have to continue Amari's rigorous treatment at home.
You're going to have to be a bit tough here too, because she is going to let out a few little screams.
Yeah.
Okay, but
it's all for the best, darling. It's going to be a lot of hard work, a lot of long hours, a lot of having to put up with a poor little thing crying, but I know it's all going to be worth it in the end.
So we're going to, in between the stretching, put her into a splint. You may not be surprised to know that we don't make a lot of kitten splints.
Really?
Yeah. There's not a huge market for it.
No, so it's going to be a makeshift type of...
Homemade. While the idea of the physio is to try to loosen up those muscles and those tendons, the idea of the splints is to really lock it in position and then get the body used to that leg being in exactly that spot.
It's okay, chicken. It's okay.
See how she gets around. It's going to be tricky for her.
but the hope is that she'll actually have to move this leg through now. And that'll build up her leg strength.
Yeah,
okay, but that's a really nice start for her now. From being told 24 hours ago that this kitten shouldn't be kept alive to now, within the last 20 minutes, actually seeing real progress, it's quite a transformation. Wendy's really been rewarded for her faith in this little girl. All right,
okay.
Big question's going to be whether Mum approves.
Yeah, she's fine with it.
Yeah.
Couldn't have thought of a better outcome, hey?
She's got a really good chance.
Yeah.
You know, as a vet, sometimes you do wonder whether once they leave the clinic and go home, whether that work will actually be truly done. But with Wendy, knowing her connection to Amari, you know it's going to happen. And she is going to have to work hard if she is going to get the results she deserves with Amari.
Oh, look, Tim, there's hatchlings here.
Oh, look at that.
You see the sand bubbling a little bit? With all this rain, we've got a bit of a hard surface, so we'll just loosen it up a bit.
On Monrepo Beach in Bundaberg, it's time for a new generation of endangered loggerhead turtles to start arriving.
We should see the sand start to bubble soon. Little heads appear.
Oh, there we go. Look at that.
Wow.
Holy moly.
A female laid her eggs in this spot 60 days ago, and now the babies are starting to emerge.
Tonight, watching those females lay their eggs and the hatchlings pop their little heads up, it's a full cycle. And it's truly amazing. I do some special things in my job, but tonight, being here, just about tops it. Here they come. A whole lot are just about to hit me. What a sight. How they tickle.
They do tickle.
They're everywhere. There's so many of them, and they want out. They want in the ocean. They're almost at the water.
Just about there. Here we go. Keep coming.
Wow, that was brilliant. Hey?
These tiny babies now face a tough battle for survival.
Less than 1 in 1,000 of these little hatchlings will make it to be an adult, and they're off.
It's hoped that at least some of the females in this group will reach maturity and one day return to Monrepo Beach to lay their own eggs and start the cycle all over again.
I have never quite seen anything like that.
Yeah.
I think it needs to be said, 50% of the world's loggerhead population breeds here, and that's because of the work you guys are doing. I mean, you've been here 20 years, so you're a big part of that, and good on you.
Oh, thanks, Tim.
Just want to get some x-rays of this guy.
Oh my God, wow. Okay, an echidna.
Yeah, we don't see them often.
Eddie has been rushed into Sash after being rescued from a suburban home.
He's bleeding from his beak, so we'll give him an anaesthetic. That way I can have a better look and we can take some x-rays and see if he's broken anything.
I know. Poor darling, he's bleeding quite a bit, isn't he?
We've got to work pretty quickly here because we're giving him an anaesthetic, which is risky, and he's bleeding quite a lot, and we've got to get to the bottom of it.
Wise volunteer Susie is trying her best to stay positive.
I'm totally hoping that he's going to be fine, that his x-rays come back all clear and that it's just a bit of superficial bleeding that can be stopped up and that he can go and be released tonight.
I'm really hoping that I don't see any broken bones in these x-rays. If I do, I don't think Eddie will stand a chance at surviving in the wild. All right, so this is it. Eddie's future depends on this one. I'm looking for fractures, any breaks in the bones, any abnormalities. But at the moment, I can't really find any breaks, any areas where there are dislocations. And I think Eddie looks like he's in the clear. Looks like Eddie's just had a nosebleed. The nose and beak of an echidna is a very vascular area, so any bump or knock can cause a lot of bleeding. I'm just really happy that there is nothing broken. All right, Elise, so he is one lucky boy.
Great, good news.
And it looks like the bleeding has stopped as well, so that is great. Him lying so still has allowed the wound to clot, so hopefully now he's not going to rummage that nose into anything and start the bleeding up again, but I'm really happy that he hasn't got any permanent damage, and whatever is done should just heal up. Let's wake him up. I always get nervous at this part. And buddy, you wake up.
It's coming around now.
There you go, buddy. Hey, Eddie. You're a good boy.
Lisa can now share the results of Eddie's x-rays with the very anxious Susie.
Hi.
How'd it go?
Okay, so that's good news. Everything is fine.
Oh, thank God. Okay. Excellent.
It looks like it's just superficial.
Okay.
And he should be just fine for release.
Excellent. All right, that makes me feel so much better. Thank you. Alrighty, so you're happy for him to be released tonight?
I think it's much safer if you keep him overnight. That way you know for sure that that nose isn't going to start bleeding again.
Okay, great.
He's such a lucky boy. I mean, he could have had a broken jaw, and the fact that he's only got superficial wounds means that he can be released, and that just is the happy ending we all wanted for our very special visitor here at Sash.
Well, I'm absolutely stoked because he's going to be fine. So he's going back into the wild where he belongs, and it's happy days.
Good luck.
All right.
Hope it all goes well.
Yes, thank you very much.
See you, Eddie. Bye, buddy. Feel better. I could not have hoped for a better outcome for this little Aussie battler. He's back with Susie. Makes me so happy that he will stand a great chance to lead a long, healthy life in the wild where he belongs.
You are one lucky little guy. Let's go.
Here we go. It's okay, sweetie.
Hello there.
Hey, how you doing?
Been wondering how you've been going.
Good.
Come on through.
Let's go. Come on over.
Wendy and Isaac have brought their one-week-old kitten Amari back to the Bondi clinic.
It's been a couple of days since I've seen Amari, so I'm very keen to see just how she's coped with that splint.
It's okay. It's okay. It's okay.
Chris had to use a cotton bud as a makeshift splint on the tiny kitten's badly deformed leg.
The unknown for me as I'm taking this splint off is how have her muscles and her tendons reacted to being put in what for them is an unnatural position.
Yeah, the good news is that we're now more comfortable in that straight position. We've managed to correct that twist. Why don't we see if she can actually move around all by herself?
Yeah. She's moving it a lot better though.
She is, yeah. See, the will is really there. This foot wants to come through.
The final challenge for Amari's leg is to get into that right angled position with her feet upwards. That way her toes can actually grab the ground as she moves that leg forward, and she might just walk like a normal cat.
So, just like we did a few days ago, we're going to start with just a little bit of physio, just to get it comfortable.
We've made really good progress in just a couple of days, but in many respects, we've had to. This is truly a race against time. We have to get her body used to this new leg position before she gets bigger, and her weight means more force is going through these legs. This time, we need something with a right angle.
Okay.
So, we're going to use a specimen container.
You gotta get more creative for me.
Yep.
The next stage in Amari's treatment is a second splint.
You'll see in a minute, mate.
This time to get her paw in the correct position.
Oh, I kind of understand it now.
Yeah, you getting it?
Getting it.
She's got a bit of a way to go yet. She just has to get used to that leg position and get the strength from that. But she's already lifting it up and she's already keen to move it through, and for her now, walking should actually become easier if she can handle this new position.
And she's a fighter, a big-time fighter, and she will continue to fight. Let's put her back into a nice little warm bed, hey? There we go, and you go there.
Such friendly little pups.
Gorgeous.
Margarita and Jerry have arrived at Sash with 3 little strays.
They're kissing each other. It's a cute little family.
The Good Samaritans found the 3 terrified Papillon pups running on a busy road.
I hate to think what would have happened if we hadn't found them, because no one was stopping, and they obviously needed help because they could easily have been run over.
Hi. Hi, nice to meet you.
Yes.
What have we got here?
Well, we haven't got any names. Just 3 gorgeous dogs.
When you found them, they were just
running on the road, yeah.
Okay.
Yeah.
We often get stray dogs here at Sash. We get 1, maybe 2, but to get 3 all together, now that's unheard of.
Bye, darlings.
We'll do our best.
Bye, darlings.
It's a reluctant goodbye, but Margarita is hoping emergency vet Dr. Lisa Chimes can help these little lost puppies.
These dogs were found running in a really busy road, so even though they look okay, it is possible that they have injuries. Now, I need to take a close look at them and make sure that they're okay. All right, guys. Let me just have a quick look at you. Okay? See if you're all well. Come here. That's the way. I'm listening to their heart and lungs, and I'm checking their colour and having a feel of their bellies. And everything is checking out okay. These 3 babies are very lucky. Okay, you look pretty good. And we just got to find your owners. What I'm really hoping is that these dogs have a microchip. I'm scanning the first dog and I'm looking everywhere and there's just no sign of one. So I move on to the next dog. Nothing. It's not good. 2 out of 3 dogs don't have a microchip. Now I'm really starting to worry that these dogs may not have an owner that I can find.
Come on, Cliffy. Can you come? Up we go.
16-month-old Cliff is being rushed into the Bondi clinic after eating something very dangerous.
Oh, good. Hello, I'm Kath. I called about the rat poison.
This is Cliff?
Yes, this is Cliff.
Hello, Cliff. We'll better get you in straight away. Okay, well, let's just find Chris.
Thanks.
Besotted owner Kath is terrified the Australian Shepherd has ingested a potentially deadly dose of rat poison.
I took my dog Cliff to work today, which I've done a few times lately. He was rummaging behind some furniture and he came out with a packet of blue powder and he pierced it and there was some in his mouth, and then I looked at it and noticed that it was rat poison, and here we are.
How long ago do you think he ate it?
He ate it at 11:05.
All right.
So 50 minutes ago.
All right. There are lots of different varieties of rat bait. The type that Cliff has eaten is bromadiolone. This one is tricky because they only need 1 dose for it to cause potentially fatal bleeding. So, yeah, the obvious concern with rat bait is it goes into their body and it blocks something called vitamin K, which is what they use in their system to cause their blood to clot. And whilst it doesn't sound like you necessarily need that all the time, each time you even move your arm or your leg, tiny little bleeds can occur. And without that vitamin K, those little bleeds can cause massive hemorrhages. You don't know how much he ate though?
No, the sachet was about this big.
Yeah.
And he pierced one side of it and a whole bunch of it fell out. There was a bit of swallowing, but I don't know if he ate maybe a thumbnail's worth or just got it in his mouth and went, yuck, I don't like it.
Yeah.
And that was that. I rang Neil. He said, you should come in.
You've done exactly the right thing in bringing him in when you have, because with this sort of poison, it takes them some time to absorb it.
Right.
So that the sooner we can act for him, the less a chance there is that he's going to absorb this and he's going to have a blood clotting problem and then a bleed.
Yeah. Cliff is everything to me. I'm completely obsessed with him, so I just hope that he's okay. You stop eating things you're not supposed to.
The real concern I have here is we still have no idea exactly how much rat bait Cliff has eaten. The simple fact is that if Cliff has eaten a lot of rat bait, it's currently being absorbed by his system, which means that his blood will very soon have trouble clotting. The sooner you can intervene, the better off he's going to be.
Hey, honey. I hope you've got a chip. I know you don't.
At Sash, Lisa is desperately trying to identify 3 puppies found wandering on a busy road.
These dogs are in really good condition, so it's obvious that someone loves them very much, but it's really concerning that 2 out of the 3 dogs don't have a microchip. I just hope that the 3rd one does. Yes, got a microchip. Yes, we do. I feel a huge sense of relief. I just hope now that I can actually get in touch with an owner.
Lisa will use the information from the microchip to look up the owner's details, which are held on a statewide database.
Okay, let's see if we can find these owners. There's no answer, there's no voicemail, so all I can really do is try again later. I just hope I can get hold of them. Microchips are amazing, but it's the owner's responsibility to update their details, and if they haven't done that, there is no way for us to get in touch with them. Okay, guys, so this is it. Here you go, up in there.
The Papillon pups will stay at Sash overnight.
All right, guys, that's the way. The 3 little dogs are now getting some R&R at Hotel Sash, and now it's my job to try and find their owner, because if I can't, who knows what their future will hold.
Let's just remember before I do what I'm about to do that you got yourself into this mess.
Naughty Cliff has a bad habit of eating things he shouldn't.
Let's do it then.
Today, his obsession has got him into real strife. The Australian Shepherd has ingested rat bait.
The best treatment for dogs that have swallowed rat bait is to make them vomit as quickly as you can. All right, so it doesn't look like much, but in here is enough of a drug called apomorphine to make him vomit. But once he does have that, I'd probably recommend we get him down on the ground fairly quickly.
Okay.
Good boy.
All right, Cliff. Okay, that'll be enough.
Good boy. Good boy, Cliff.
Go, buddy. There you go.
Owner Kath is extremely worried. She knows that even the smallest amount of bait could cause the 16-month-old to suffer potentially fatal internal bleeding.
It's rat poison, and it's obviously designed to kill. I've known dogs who've died of ingesting poison, and I just hope that we caught it in time.
The anxious pacing is really a place we've all been.
Right. Looks like he's starting to feel a bit spewy.
If Cliff vomits up blue, we know he's eaten a lot of rat bait, and we're about to find out. Here we go. Any more to come, Cliffy? Yeah. Oh, this one's coming from deeper.
Get it all out. It's all right, Cliff. Good boy.
That was important. You see that?
Yeah.
I'd be quite concerned if this was a wash with blue.
Yeah.
And it's not. There's little chunks of blue.
Yeah.
But if he'd eaten a lot of it, it would stain the entire vomit. So I'm confident that since we've got to him within an hour, that he hasn't actually absorbed enough rat bait for it to be a problem for him. And that's the really comforting thing.
Oh, good. Thank you.
It's been quite an effort for Cliff, but thankfully, all the bad stuff inside of him is now outside of him. That look on your face, Cliff, really says it all, doesn't it? It's not a good day.
I don't know if he's going to want to watch your show anymore. You might have lost a viewer.
Cliff does look pretty helpless right now, but thankfully I can give him an injection to reverse some of this nausea and make him feel a lot better. So he won't exactly be bounding out of here, but at least he won't be projecting himself out of here.
Yes, and we know he's okay.
Yeah.
I feel really lucky that we found him before he ate the whole packet, because I can't imagine him being sick or not being with me. So I just feel really, really lucky, and I can go home knowing that he's fine.
Good luck.
Yes, thank you very much.
Hopefully it'll be the last time we see you for a while,
Yes.
at least. While Cliff might be leaving here today with slightly sad and confused eyes, it's the eyes of Kath that are always going to need to be on Cliff in the future.
No more rat bait, ever.
Guys, come on, relax, settle down.
It's been 24 hours since 3 little lost dogs were brought into Sash.
I've been trying desperately to get in touch with their owner. It's just really upsetting that either they've gone on holidays or they haven't changed their details on the microchip register, and now we can't get in touch with them.
Hey guys, just settle down. Settle down.
We've called these little dogs the 3 Musketeers. They are absolutely adorable. Come on. But unfortunately, they can't stay at Sash forever. So I've been in touch with the Animal Welfare League, and they're going to take these little Musketeers in and try desperately to find their owner. And if they can't, they'll try and find them a brand new home.
Hi.
Hi.
How are you?
I'm all right. Hi, guys.
So these are the little dogs I've been telling you about.
Hello. 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 Where's your family?
Rose from the Animal Welfare League has kindly come over here to try and help us find the owner of these dogs. They're clearly loved.
Hopefully they're all from the same family and we'll be able to track down the owner of these beloved dogs.
All right, so they're all yours.
Thanks very much.
Hey, little
all right,
handfuls.
Guys.
Hey.
All right, let's go.
Thank you so much.
Oh, no, thank you.
Good luck.
All right, I'll keep you posted.
Bye, sweetheart.
See you later.
Thank you.
This way, guys.
I really, really hope that she's successful because they're clearly loved and they deserve to be back where they belong.
I'll keep you posted.
Thank you.
Hey, Amari. Well, Chris won't be long. Now you can have a look at those legs. Hey, we'll see how they're going.
At the Bondi Clinic, Wendy and her children Isaac and Imogen have brought in Amari and a couple of her siblings.
Oh, what a little splint you've had on. Hope it works, hey?
Little Amari is now 6 weeks old, and it's time to see if there's any improvement in her badly twisted leg.
Lots of physio, probably 20 times a day we've been doing stretches and with the splints and lots of screaming by her, but hopefully it's been all worth it. Now let's put them down, okay? We brought a few others.
As Wendy and the kids are walking in with the kittens, I'm thinking, Amari is just 1 kitten. Why are there 3?
I guess it's a really good thing that I can't actually pick which is which.
My challenge for Chris, well, I brought 3 kittens in today. They're all exactly the same colour, about the same size, and I want Chris to pick which one is Amari. So they are pretty cold there. So if you look at that, he's actually a little boy. You're getting a little bit warmer.
That's not her?
That's not her. Hey?
It's you.
It is you, Amari. You go.
Really?
Really.
But look on those back legs.
She's a muscle girl.
Look at that walking. My mind keeps on going back to that moment just a few weeks ago where I was confronted with a kitten with a badly twisted leg and not much hope of survival. That's a very rare thing to see in a kitten, just to have that leg twisted and hanging like that. Wow, and she's almost able to bend it right up on itself there.
That's what he said, isn't it? Without crying too.
She's a little powerhouse though. I'm actually pushing reasonably hard there. I knew from the moment I gave Wendy those instructions about what she had to do with Amari's leg that she'd find it hard and she'd find it confronting because she had to push past Amari's pain threshold. But looking at what she's done, I'm in awe. She's done a remarkable job. I think you've been through enough hurdles for a lifetime, little one. So you can just enjoy the rest of your life like you're enjoying this chin scratch.
There's no way I would have been able to do this without your help. It's been absolutely tremendous and I can't thank you enough.
No worries at all. I did my bit, but you're the one that stared down those people that said she should be put down and said, no, I'm going to give her a chance.
Well, that's it. I'm a determined one. She was so cute. Like, there's no way I could do that to a cat.
Amari has really occupied a really special place in Wendy's heart. She's been so determined, so dogged, and has made sure that Amari has overcome massive obstacles to be here today. And now she's got a life with Amari to look forward to.
As for our 3 little lost puppies, Their owners couldn't be located, but they've now found new homes, and Lisa is thrilled.
I just love warm and fuzzy outcomes like this. These 3 little dogs arrived with Margarita and Jerry. We gave him some TLC, some medical treatment, and now these little musketeers have found brand new homes. And that is just the best news ever.
Despite it looking like everything moves pretty slowly around here, things happen.
It's Chris's second week volunteering with the busy Esther Honey Foundation in the Cook Islands.
They've had a lady call in from an outer island, Aitutaki, which is about 300 kilometres away, with a cat that has part of its nose missing. She's already on her way in now.
Emergency arrivals like this are not unusual for Cook Island pet owners, and Chris is currently one of just a handful of vets on call.
It's a bit of a new situation to be waiting for an animal to arrive, but it's an important one. You're right there. You're Poppy, right? Hello, how are you? Hey, lovely to meet you.
Thank you.
The small one?
Yes.
Oh, wow. Yeah, it's nasty. My first impressions looking into the cage there and seeing small one's nose are that, look, it could be a lot of things. It could be an open wound from a fight, it could be a nasty infection, it could be a virus, or, worst case scenario, it could be cancer. We'll get to the clinic as quickly as we can.
So small one is really important to us, and we are really concerned about the sore on her nose. That's why I've just flown in. She's got the opportunity today to see Chris, so hopefully we'll have a good outcome to this long journey and the long day ahead.
Okay, come through here.
Thank you. Yeah, thank you for seeing her. We really appreciate it.
It's all right. Here we go. Yeah, wow. So, I mean, that's the first good look I've had at that nose. It's obvious that a big chunk of that nose is missing. So how long's that all been happening for?
So probably 4 weeks ago she had a cold,
Yep.
and then her nose ran, and she constantly licked, and because her tongue is like sandpaper, she licked a divot between her lip and her nose. And it's just got steadily worse for the last 4 days. It started to bleed.
I guess the sight of that blood probably made you more worried.
Yeah, that's just saying it's time to do something.
Yeah. Small one has lost a massive amount of her nose, and it's happened quickly. So obviously, that's of huge concern. What we're dealing with here is clearly very serious. If her temperature's normal, then we start to get to the stage where we can start to rule out a virus.
Yeah.
A bit over 38 at 38.1, 38.2 now. Okay, so that's normal. Yeah. So a lot of the viruses we worried about that can cause erosions around the face of cats, they usually cause ulcers on the tongue or serious irritations and really red inflammation around the mouth. Okay, let's have a look in here. So this is obviously the problem area.
That's okay.
Her gum colour's nice and pink, so she's got some good circulation happening. That's good. Okay. Despite her having a big problem around her nose, the inside of her mouth is actually looking pretty good. There's no doubting how much Poppy cares for small one. She's just flown over an hour just to have her seen by a vet. My concern is, though, how's she going to handle the news if it's not good? Look at that, and she's lost about 1 centimetre of her nose there. Losing that much of your nose, it's certainly not normal. What I guess has worried me ever since I first saw her is that she actually may have something a little nastier there.
I'm upset, yeah, because I had hoped that it would be a virus, but I think because it's happened so quickly, it's hard to comprehend. It's a huge thing. It's a lot to take in at the moment.
I'm excited about today. I'm on the other side of the country in Broome. I'm here to help out a good mate. He said to me, "Tim, I've seen you move a few crocs before, but how about you come and help me with Bluey?"
At the Broome Wilderness Park, Big Bluey already knows something's up, and croc keeper Dave Tapper is anxiously waiting for Tim to arrive so they can start relocating the massive beast.
Good morning, mate.
Hey, Tim. How you going, mate?
I'm good.
That's good.
How are you?
Yeah, well.
Big day?
Yep, big day planned.
Where is he?
Just up the way there. I've got a couple of boys just keeping an eye on him at the moment. Let's go. Yep.
Bluey will be one of the star attractions at the new park, 16 kilometres away.
Bluey, there's a bit of a story. He was captured from the wild. He was eating horses on a cattle station. So, problem croc. And he's been here for about 15 years and he's very loved. He's a real character. But he's 5 metres, 500 kilos, maybe more.
A huge team of helpers has been rounded up for today's operation.
This is a big move. We've got a big croc, very dangerous, especially for us, but also for the croc. It needs to happen smooth. It's high alert and we need to be careful at every stage.
All right, so everyone's ready? All right.
All right, guys. Dave, Chris and I go into Bluey's yard and he's nowhere to be seen. Just watch that rope, eh? Bang! There's Bluey. He's out and he's right into position. Whoa! That first rope needs to go on now. We need to have our wits about us because a croc like this, make a mistake, you only get one chance.
I can certainly sense some urgency from you, and the reason there's some urgency coming back from me is because there's not a lot more of her nose that she can afford to lose.
Yeah, we're more than worried. Yeah.
In the Cook Islands, Poppy is desperate for help for her much-loved cat, Small One.
My concern is that the tip of her nose, in the last month or so, has developed a skin cancer. The problem with the types of skin cancers that cats get, they're not melanomas. They're not going to spread around the rest of the body like a melanoma can. But what the skin cancers they get actually do is they start to eat away at the area that they're growing in. And cats get something called squamous cell carcinomas. When you look at Small One, unfortunately for her, her nose doesn't have any pigment. It's not black, it's white. And with that white colour means there's no protection against the sun.
So if we had left this, she would probably have died.
Yeah. So that
Shortly.
Yeah, that cancer will eat into her face.
Okay.
And will continue to do so until it's just too much for her.
It probably feels like we've let her down a little bit.
No, you haven't. You've just flown
I
an
know.
hour from another island
Yeah.
to come to a vet to help her out. And her best chance of having a life after today is in acting right now. All right? I know that's a lot to take on. Usually working out a solution as to how you're going to remove this kind of cancer takes weeks or even months. Right now, I've got hours. We don't have the luxury of taking a biopsy and sending it off to a lab and waiting for the test results. We've got one day to fix her.
Yeah.
And that day has to be today. Don't want to muck about. I want to actually take her into surgery right now, if that's okay with you.
Yeah. We would really, obviously we really love her.
Yeah.
I can't really go in without her.
Well, let's make sure that doesn't happen, huh?
Please.
I'm looking at Poppy and the love that she clearly has for a cat. She's heartbroken right now, but what she's hanging out for is some hope. I'm hoping I can give it to her.
In Broome, Killer Croc Blue is putting up a fight.
Jeez. Rightio. Feed back on that, Tim. Yep. Pull back. Some of it.
The massive beast is using all his 500 kilos to resist efforts to get him out of his pond.
It's gonna roll. Okay, just hold it there. Keep the tension on. Let him roll. Perfect. Get a bit of slack, guys.
Tim has been asked to help move the 5-metre monster to the new crocodile park.
This is where it gets hard. Bluey's got the first rope on and he's thrashing about. All we can do is try and hold on, but he's way too strong for us.
Right, now
let him roll. A bit of slack.
It's an epic struggle.
Let him roll.
The angry croc wants to retreat back into his pond.
Hold up, boys, not too much on him.
Then suddenly he starts heading straight for the fence.
Just keep the pressure.
Jeez. Bluey has the ropes on and he's doing big death rolls. And he hits the fence, bites it and rolls into it. He's that powerful. This is a problem because if he can't get himself unstuck, I don't know what we do.
In the struggle to free himself, the giant croc is now also using up too much energy.
Big crocs like this can build up lactic acid. That can kill them. That happens because they struggle and they stress out. Do you want us to give him a bit of slack for a sec?
Yeah. Just a little bit, yeah.
Little bit of slack on.
The team is running out of time. They now have just precious seconds to try to release the agitated croc.
This needs to be fast. If Bluey overheats, he'll die. Come on.
Oh, ouchie.
Yeah.
Doesn't look very nice, does it?
No, it doesn't. Hopefully, today ends all that.
At the Esther Honey Foundation in the Cook Islands, the procedure to remove the aggressive skin cancer eating into small one's face is about to begin.
It's okay.
I'm just trying to remove some dead cells from the surface, and already you can see the problem with this nose is that the blood supply is so great that we're getting a lot of blood coming out straight away. The fact is, if I was back in Australia, I'd use radiation therapy to treat this kind of cancer. Now, I cannot import that technology into the Cook Islands to use it on small one. It's just not possible. So we have to go with the next available option. All right, if she's stable, I might start freezing now.
Faced with limited resources, Chris decides to use human medication to try to kill the cancer cells.
So we're just going to do about 30-second applications there.
Okay.
He's using a wart removal treatment containing liquid nitrogen.
Oh, wow.
It's working well.
Yeah.
The whole idea here is to use multiple cycles of freezing, thawing, and that way the problem cells, they defrost, they expand when they're frozen, and hopefully then they pop. Then you let them defrost, then freeze them again. That process should actually kill them.
That's 30.
Using a wart removal treatment seems like a crazy idea, but you've got to remember, warts are essentially benign growths. So the same principle applies. You have to penetrate through the outer tissue, get to where that whole tumour is coming from, and kill off those cells. So we can see that we're getting a nice line of frozen tissue coming away from where I'm applying this, which is exactly what I'm looking for.
5 more seconds. Okay.
I'm probably being a little bit more aggressive than I normally would be, but the way I see it is this may be the only treatment that small one gets.
That's 30.
It's an anxious wait for small one's owner, Poppy.
Nervous. I suppose it's probably all I can think. It's just apprehensive, hopeful.
Just going to do one more. Okay, all right. We're done. The hope is that over the next few days we get a scab forming. It'll then drop off, and underneath that should be healthy tissue. You're just waking up, aren't you? There we go, big yawn. It's gone well.
Has it?
Yeah, it has.
Okay.
You can relax.
All right.
Yeah. So we've managed to freeze those sections of the nose 3 times.
Wow.
So we gave it a really good go. Okay, and she's just waking up now, and she seems pretty happy there.
Some people might say it's just a cat, but it's still part of your family. Definitely wanted to make sure that we've done everything we can to give her the best opportunity, and I think we've done that. Yeah, you're great. Thank you so much. Yeah, really appreciate it.
When it comes to commitment, Poppy is right up there because her love and devotion towards small one just cannot be questioned. This cat clearly means the world to her.
boy. Come here, rascal. Hey, you rascal.
A young border collie has been rushed into the Bondi Referral Hospital, Sash.
Rocket ate a loaf of bread that I was making, and nearly an entire loaf. There was all bar about 1 bun's worth left.
What about this big?
And we've noticed he's been expanding ever since, and looks like he's about to give birth to a litter of buns.
Katie and her children are worried about the greedy pup's behaviour.
Rocket has been known to eat quite a few things that he's not supposed to. So far he's eaten the arm out of a chair, he's eaten underpants, bras, t-shirts, socks, several pairs of shoes. So he's got good taste, but a bit naughty.
Hello. Got 4. 4 children here. Which one's Rocket?
The big fat one, full of dough.
Hi, sweetheart. What did you do? Come through.
Thank you.
When Katie first arrives, she thinks Rocket has been up to his old tricks again, eating something he shouldn't have. And as soon as I look at Rocket, the first thing I see is that his abdomen is really, really big.
He's pulled down a tray of dough, and it was quite a large amount. I'd made 2 breadsticks.
Okay. The biggest concern is that when they have eaten dough and that yeast rises, that yeast can form alcohol.
Okay.
And then he can actually get alcohol poisoning from it as that alcohol gets absorbed into his bloodstream. So it's a really, really serious problem. It can be fatal. Katie's face literally drops when I tell her how serious alcohol poisoning can be. Yeah, so his tummy is feeling really full and uncomfortable there.
Yep.
As time passes, Rocket's stomach is getting bigger and bigger, which means that dough is continuing to rise as if his stomach is an oven. So the plan is I'm going to take him out into the treatment room.
Yep.
I'm going to give him an injection to make him vomit.
Okay.
If he doesn't bring up the dough, then we'll have to give him an anaesthetic and pump his stomach.
Yep.
If we can't get it out that way, he'll have to have surgery to have the ball of dough taken out of his tummy.
I understand. Oh my God, I could really lose my dog. And yeah, that's not a place we want to even go. We lost a dog a couple of years ago, and the family's not really been the same since.
Come on, Rocket. Come on, bud. I know it's scary. Come on, doll.
Okay, the wait is over. Here she is. So she's had a good chance to rest.
Hello.
She's still a little bit drowsy, but...
In the Cook Islands, it's been 2 hours since Small One's unconventional procedure to remove the aggressive skin cancer attacking her face.
Small One. Hello.
Straight back
to you. Did you miss me? Let me see. Hello. Let me see. Oh, that looks excellent. Look at you.
Yeah, so it's just going to dry out a little bit, and she may get a little scab forming there.
Hello.
But
Yes, I'm here. I know. That's okay. Good.
seeing Popper's reaction to having Small One back by her side, you'd think they'd been separated for days, not hours. But it just shows you, no matter the language, no matter the country, no matter the destination, that commitment and that love for pets is just the same.
There we go. Good girl. Good girl. There we go. Come on, Small One. That's all right. There we go. Time to go home.
I'll take you to the airport.
Excellent.
You ready to fly now? Go back to the island?
I feel like we've achieved something today, and I just want to get her home so we can get life back to normal for her and for me. It's been great. Really pleased.
She's going to become a frequent flyer.
I think so too. She gets some air miles.
There's no way of knowing exactly how much time we've managed to buy Small One through doing this procedure. But the fact is, without it, she was seriously on borrowed time. You can never accuse Poppy of not moving heaven and earth to do everything she can for her Small One. So the two of them, they deserve so many more happy years together.
Appreciate it.
My absolute pleasure.
Thank you so much. To everybody, eh?
Okay.
All right.
I'll be checking in, okay?
Make sure you do.
You just give me a reason to visit Atutaki for a holiday.
I might have to do that again.
A working holiday.
All right.
All right, safe flight.
Thank you very much.
See you soon. Bye-bye.
See ya.
All right, Sam, we're going to just give this IV. It's an injection to make him vomit. All right, buddy, it's just going to be a little sting.
At Sash, greedy young Border Collie Rocket is in grave danger after gorging on a huge batch of bread dough.
Eating raw bread dough is a serious emergency in a dog. That dough rises from the yeast, and as the yeast releases alcohol into the bloodstream, that dog is going to get alcohol poisoning, and that can lead to death very quickly.
It's okay. Look at me. What's going on?
It's now a race against time to get the fermenting dough out of the young pup's stomach.
All done.
Done. It was like a little bee sting. Hopefully Rocket will respond to this injection and will vomit up the bread dough, because if he doesn't, things are going to be a lot more serious for him.
I know, I'm sorry I've made you feel sick. Hey, bud. Good boy. Here you go, darling. Let's get it all out. That's the way. Come on, hun. Good boy. That's a nice big amount. Let's get it out. Out it goes. Oh. Good boy, hey? That's a nice big one. I wasn't expecting such a big vomit.
Rocket hasn't stopped vomiting. There is just more bread dough pouring out of his mouth. His stomach was absolutely packed with the stuff.
Good boy. Oh, there you go, sweetie.
As much as I hate making dogs vomit, I kind of feel good about making Rocket vomit, because he's brought up this big lump of dough and he's potentially saved his own life.
So there was the one piece of bread, there, and here's the other piece of bread. And then the rest of the liquid is probably just, it's starting to be digested. That is disgusting, buddy.
Rocket's sitting there with a very sad and sorry look on his face, and I think he's feeling a little bit guilty too.
But the exhausted pup's ordeal is not over yet. Lisa wants to run urgent blood tests, and the pup will have to stay overnight at Sash.
We're running some blood tests on Rocket now. We need to make sure he's not developing signs of alcohol poisoning and that he's not becoming dehydrated. We'll have to keep a really close eye on him while he's in hospital with us.
There we go.
In Broome, gigantic croc Bluey is gradually untangling himself from a perimeter fence.
Rightio, pull away.
The massive 5-metre croc is being relocated to a larger wildlife park.
With a bit of encouragement, thankfully, Bluey unrolls himself and it's game on.
Okay, hold the tension on there.
Yeah. We'll let him turn, eh? That's it.
Perfect. I want to try and keep him off the fence, so give him a little bit of slack.
Little bit more, little bit more.
Hold on, just hold your ground.
Now it's all hands on deck. Keep that pressure on Bluey. There's a few of us working in and around him. If the guys don't keep the pressure on, he's going to whack one of us.
Okay, Pete, you got your advertise? Perfect.
Finally, Bluey is subdued. The team needs to quickly tape up his lethal jaws before they inflict any damage.
Once his jaws are restrained, then we take a little breath because he can't bite anymore. Happy?
Snap it off, mate. Perfect.
Now we've got the jaws secured. The main thing we've got to watch out for is when Bluey rolls or thrashes that tail about. He can break your leg, pop your knee, really easy.
Put a couple of you on the tail, couple grab the legs.
Let's give us a hand here on this one, mate. You got that one? Let's work on that one first. Fair enough.
Bluey won't stay quiet for long, so Tim and the team need to keep moving.
Crocodiles expend energy and they need a little bit of time to reboot. So by moving him quickly, we're hoping to avoid that point where he's able to build up fresh energy and become a problem. Rightio.
Ready? One.
Grab hold, Pete. Go. Pull. That's it. Perfect. Turn him a bit.
That went well. He bowled himself up in the fence for a minute, but he came right back out. Good capture.
Okay, stop. Perfect.
Now we need to move quick and get him to his new home before that lactic acid builds up, because that can really hurt him.
That went well, Dave. Yeah, so far so good.
It's a new experience for you, isn't it?
At the Esther Honey Foundation in the Cook Islands, Chris's next patient is already waiting.
Hello.
Hello.
How are you?
I'm good, thank you. How are you?
Good, I'm Chris.
I'm Virginia.
Nice to meet you, Virginia. I'm doing some work here.
Oh, it's great that you are.
Who's this?
This is Lady.
Hello, one. Hey, how are you? This is sniffing me out. You're not from around here, are you? All right, what's Lady's problem?
She's got a sore ear. When you touch her left ear, she cries.
Devoted owner Virginia has been trying to get help for Lady's chronic ear problem for the last 4 years.
Did have it looked at, but they said it was sensitive ears. I'd tell everyone not to touch her ears because she'd cry. It's all right, it's all right.
She's just whimpering when I touch her around there. She's real softy, isn't she?
Yes, she's a beautiful dog. It's all right, all right, it's all right. Yes, it's all right, it's all right.
Given how strong the connection is between Virginia and Lady, it must have been so hard for Virginia to watch Lady have this ear problem for all these years. Is the ear problem an issue all year round?
No, it seems to get worse when it's the summer, when it starts getting humid and hot, and she goes down to the sea and goes for a swim and then goes fishing.
Fishing?
Fishing, yes.
She's a fishing dog?
She's a fishing dog.
Well, I wouldn't have picked that. There are no fishing dogs in Australia that I know of. They're quite unique. A dog that has fishing as a hobby is a classic example of the fact that the dogs here in the Cook Islands live a very different lifestyle. But for all the differences, there are some similarities as well, because the owners here in the Cook Islands, just like they are back in Bondi, are determined to do everything they can to make sure they stay as healthy as possible.
It's all right. Good kid.
Virginia has high hopes that Chris will finally be able to fix her special girl.
When I saw in the newspaper that Chris was coming, I thought, right, that's my opportunity. It's all right. All right.
Okay, fellas. Now this is the bit that's really going to test your mettle. Like I said, he's a very heavy animal, so lift safely, bend at the knees.
In Broome, Big Bluey is about to put Tim and the team to the toughest test of them all.
1, 2, 3. We're a bit light up here.
The 500-kilo heavyweight is being moved to the truck that will take him to the new park site.
Shuffle, shuffle, that's it. Even though we're all prepared and ready for the lift, it's still caught everyone by surprise. The immense weight of Bluey is a real struggle. Okay, and down.
No toes. Glad we had a few extra people.
The road trip to Bluey's new home is just 16 kilometres, but every minute he stays restrained is critical.
I'm sure he's stressing out. He's probably wondering what's going on. It's been a long time since he's had ropes on him and been captured, and our whole operation, of course, is to minimise that stress to him.
Got a mattress for under his chest, just to stop the vibration. Now the crane lifts Bluey onto the truck, and we put some wet blankets on him and a shade structure, because we've got a 15-minute journey to Bluey's new home. We need to move fast. If Bluey overheats, he'll die.
I think Pippa's more worried than anyone, isn't she? She misses her big brother already, don't you? Hey?
At Sash, Katie and her family are anxious to find out if Lisa has managed to get the bread dough out of their other puppy's stomach.
When I first saw that he'd eaten a heap of dough and he was feeling a bit sick, I said, well, you brought this on yourself, buddy. That's what happens when you steal things off the bench, because he does it a lot. And yeah, I had no idea that it was actually quite as serious as it was, to be honest.
Hi. Okay.
How is Doughboy?
All right, so the good news is we managed to get him to vomit out quite a lot of that dough.
Good.
So 2 very obvious pieces in there.
Okay.
Because some of it probably has been absorbed already, we do need to keep a close eye on him. So it's for the best if he stays in hospital tonight on a drip, so that we can flush any of the remaining toxin out of his system.
Don't worry, Mike, it's going to be fine.
Rocket is not completely out of the woods. He's still at risk of some form of alcohol poisoning, so we need to have him in hospital on a drip to make sure that he's going to be safe. All right, guys, do you want to come see Rocket?
Yes, please.
Hey, do you want to come see your brother?
Yes, please.
Let's go.
It's going to be really horrible going home without Rocket. The kids are going to miss him. I'm going to miss him. So let's just hope we can pick him up tomorrow and that everything's okay. Good boy. He feels like he's lost about 3 kilos. don't you, hey? You got rid of the buns from the oven, hey? I know, I love you too. Yes, I do.
It's really not going to be easy for the family to leave Rocket here in hospital. He's only 1 year old, he's just a baby, and they are really going to miss him. I just hope that I can get him home to them as quickly as possible.
Good boy. Hey? Bye, Rocky. We'll be back soon, okay? You be good boy. We'll be back soon. Good boy.
But I hate walking away seeing him like that, with the drip about to go in and potentially not knowing what the outcome's going to be. So yeah, we're going to think positively, kids, aren't we?
So she goes in the water a lot then?
Yes.
Okay.
In the Cook Islands, Chris is trying to work out if Lady's unusual hobby is the cause of her chronic ear pain.
She loves going down to the beach, into the water and having a swim and then do a bit of game fishing, I suppose you'd call it. You know, looking for the fish and trying to catch them.
As a vet, you develop some strange skills. And one of them is being able to smell things that don't necessarily smell great.
Yeah.
The smell of her ears is very much like a yeast infection. Yeast infections are normally caused by a bug called Malassezia. It's a normal skin fungus, but what happens is once moisture gets in there, it multiplies like crazy. It's actually the body's own response to it, the inflammation, that ends up causing the pain. And right now, Lady is in serious pain.
Yeah, I know. It's all right. I know.
It's quite sore and sensitive too.
Yep.
We're getting some fairly dark wax in there. So obviously she has some sort of ear infection. A dog's ear goes down and then in. It's like an L shape.
Okay, yeah.
And it's very easy for water to go down and in, but not come back out.
Oh, I'm very surprised because I hadn't thought that the water would actually cause an ear problem.
What I'll do now, though, I'll actually clean her ears out for you now.
Oh, thank you.
And then we'll put some drops in there.
Yep.
And the drops will do two things. They'll take away the swelling, but they'll also treat the infection.
Oh, thank you.
This is obviously the hardest part for Lady. That infection has been festering for a long time. So removing all of it with this solution, it's not going to be comfortable, but at the same time, it's our best chance of curing the problem. So what I'm going to do is put this little mix of antifungal wash into her ears.
Okay.
And then I'm going to suck it back out.
I know.
Yeah, it's a bit sore, isn't it? So I'll just dry it out.
Oh, baby, it's all right. It's all right. It's all right.
See, look what we're getting out. Ear goobers.
You can smell it now.
Yeah, it's a beautiful smell. It's okay.
It's all right.
With Lady's ear now clean and dry, antibacterial drops will need to be applied regularly to clear up the infection.
Okay. And we're all done.
Oh, thank you so much.
That's all right.
After 4 years, I'm just so wrapped that we found out what was her problem and she's not going to be in pain anymore. And people can pat her ears that she likes because she likes being scratched. Well, look, thank you.
It's all right, no worries. Lovely to meet you.
Yeah, it's nice meeting you too.
Nice to meet you, Lady.
Say thank you. Oh, you probably think I'm not going to say thank you.
Good luck fishing.
That's a confident croc.
Yeah, exactly. It went pretty well. I was pretty happy.
In Broome, Bluey is finally on his way to his new pond at the relocated crocodile park.
Now he's heading home.
Oh, I'm glad for that. The release? Oh, that could be a different story. Yep.
Tim is desperate to get the 500-kilo croc back into the water, so unloading has to get underway as quickly as possible.
Let's get him off. When we let Bluey go, we want to see that he's full of energy. If he's not, and he's lethargic, and he just sits there, that's an indication that he's exhausted. We want to see a firecracker. That means he's got plenty of energy, and this was a success. We'll point his head right at the water.
The dangerous release is creating plenty of interest.
We've all braced ourselves ready. We just need to get those ropes off quickly, safely, and get out of his way. Rightio, Tim, we're going to get cracking on this?
Yep.
Okay. So his legs are free? Right.
What's the tail? My stomach has butterflies. Dave is going to cut all the ropes, cut all the tape. Some people will be on Bluey, and my job is last rope. I'll have the only rope that's holding his jaws shut, so when everything else is gone, I'll hold on tight, and hopefully it unwraps. Hold him. Whoop, whoop.
Hold him, guys, hold him.
This is where someone can get seriously hurt.
All right, clear off. Get back.
Back behind me, Rocco. If Bluey doesn't stick to the plan, as soon as he can feel freedom, whack, he's up. He's okay.
Once he gets a look at that water, he should just walk straight in. It's pleasing to see Bluey have some sort of energy. We know then that he hasn't built up a great deal of lactic acid in his body.
Here we go.
Go on, big boy.
Keep going.
Bluey's finally in. It's been a big day.
It's a real thrill, a real buzz to finally move him. He is a great crocodile, very dynamic. He's great on tour, and it'll be good to see him back on tour and, of course, pleasing the crowd.
Well, he's happy, mate.
Yeah, no, that went pretty well. I'm happy with that too.
He was cheeky.
Oh, yeah. Caught us a little unawares at the end there, but yeah, still went well though.
What a day. A 5-metre saltwater crocodile, captured and successfully removed. That's a good day in my book.
Hey, buddy. How are you feeling today? Hey, come on. Out you get.
At Sash, it's been 24 hours since Rocket's bread dough binge.
Let's have a feel of your tummy, see how you're feeling.
Lisa had to act fast to induce vomiting to get the fermenting dough out of the dog's stomach.
He's bright, he's happy, his abdomen is no longer filled with gas, and the good news is he hasn't shown any signs of alcohol poisoning, which means that he's ready for some food and hopefully we'll be able to go home. Rocket, have a look what I've got over here, bud. Sit. I think this is wishful thinking, but sit.
With bread off the menu, Rocket will have to settle for good old-fashioned dog food.
Good boy. Rocket has definitely turned a corner today. He's eating well, and I think he's ready to go home.
Have you seen Dr. Lisa yet?
Rocket's welcoming committee is anxiously waiting.
I think we've all missed Rocket very badly, haven't we?
Yeah.
Yeah, he's the main fixture of the household.
He's over there. Come here, buddy. What you doing? Hey. Hello.
I'm pleased to see you too. Oh, no, he's going to try and fight with everyone. Hello. We're pleased to see you too, matey. You've lost a bit of weight. Hey? You lost a couple of loaves. Rocket is a completely different dog from yesterday. He's about half the size that he was. He's full of beans, he's lively. It's good to see him back to his usual naughty self. Thank you so much.
No problem. Oh, thank you. Well, I'll have to keep these ones away from Rocket, I think.
Yes.
knowing his behaviours.
But given what happened.
You know what? I'm just going to pass on bread for a while. When Katie brought Rocket in, I don't think she realised quite how deadly eating dough could be. But he's responded well to the treatment, and luckily he's going home back to his normal self. And hopefully, from now on, she'll be keeping that bread dough well out of reach. Good luck.
Thank you. Thanks very much. He's going to push you.
See you later.
Thank you. Come on. All right.
Now, Amy,
Yeah?
I know you guys are flat out, but I've got to go.
That's too bad.
Thank you for everything.
We're very welcome.
Before I go, though, you guys do pretty amazing things off not very much. So here's a little contribution. Just some medicines, some equipment, bandages, syringes, just the basics.
Chris is about to head home from the Cook Islands, and as a parting gift to the Esther Honey Foundation, he's delivering some much-needed veterinary supplies.
Every little bit helps and that's great. Thank you so much.
Okay. Clearly, someone's very disappointed to see me leave.
Yeah, very disappointed. Very disappointed. Payment for you?
Wow, you pay big bucks.
We do.
And this is going to be a big stomach ache if I eat all of these before the flight, but thank you.
You're welcome. But before you go, there are a few paddlers who want to take you out paddleboarding. So, yeah.
I've got like maybe 2 hours before the flight.
Yeah, I'd go see him.
One thing I've learned is that island life is never dull. This time though, I reckon Amy, she's got to be setting me up. I think I just worked out who the local paddlers are. Wow, I've got to have a go at this. Turns out the paddlers that Amy sent me to have a paddle with, they're not human, they're hairy. Do they trust me enough to go for a ride? Come on, good. Your balance needs to improve. Oh, gee. The canine paddling world, it's pretty cut and dry. If they don't like your style, they're out of here. Don't leave me now. Don't leave me. I don't hurt. Here's you. Swap paddling partners around here. I've got a new partner in crime. This is almost like the aquatic version of The Bachelor. You try different partners, see who works for you, and in the end, hopefully you're happy.
He knows what's up.
Yeah, it's more like it. Sometimes life's all about finding the perfect partner. One that works for you. It's done mine. I can go home now. It's not every day I'm out in this part of the country, but this is no ordinary case. A piglet born with only one trotter. She's clearly beaten the odds just to get to this point, so I'm going to see if I can help her out.
Chris is in Carrara, about 2.5 hours southwest of Brisbane. He's responding to a call for help from some big-hearted farmers. They're worried about Stubby, a very special baby.
How are you?
Hi, how are you?
It's Belle, right?
Yep.
G'day,
Nice
how
to
you
meet you,
going?
Chris.
Hey, nice to meet you.
Tim.
How are you, Tim? Now, where's our patient?
She's inside still.
Oh, wow.
So this is our little Stubby, and she was born without 3 trotters.
Wow. Look at that face. She is.
Just beautiful.
Extraordinary. I pick up Stubby and realise that, you know, it's one thing to hear about a piglet born with only one trotter. It's another one to have it in your arms. And look at her right now, she's got one hell of a struggle on her hands. Was she born like this?
Yeah, she was.
Yeah.
Yeah, it's the first time we've ever had born like this. I don't even know if she would have got through the night because she didn't have the trotters to hold on to her teat and she would have just got pushed out of the way. So I held her up to her mum's nipple.
Wow. So you knew straight away she just couldn't survive?
She wouldn't have, no. Stubby, she's only been in our home for 3 weeks, but she's already a huge part of the family and a huge part of my heart.
What worries me is the fact that without those trotters, her life is going to be truly limited.
Yeah.
I want to be able to help you
Yeah.
and see if we can find some sort of solution here that's going to be a long-term fix for her.
Yeah, because I don't want her to be in pain or anything.
No.
I want her to have a good little life.
Yeah.
Our vet said to put Stubby down, so Chris is our last resort.
At the moment, she's truly up against it.
Yeah.
Because, you know, I've seen animals with one leg deformed, but to have 3 like this,
yeah,
it's a big issue. There's no doubt that Stubby is right up against it. I mean, normally addressing a problem in 1 or 2 legs, that's a big challenge. But with 3, she's facing an uphill battle.
Up, down, hon. Okay. Hey, buddy. What have you done?
18-month-old Skittles has been rushed into the Bondi Referral Hospital Sash in a serious condition.
So this young Great Dane has come into the emergency room after suddenly being unable to use his back legs.
Yeah, that one's significantly reduced.
I'm using a patella hammer to check his reflexes, and I'm really concerned about his back right leg. When I clamp forceps on his toes, he can't feel a thing. If we try and walk him forward, can we just see if he's got any will to use those legs? Good boy. I can see that he's got some movement in that left back leg, but in the right one, there is nothing at all.
We'll be fine, dear.
Devoted owners Rad and Nicole are devastated about Skittles' sudden deterioration.
Are you Skittles' family?
Yes.
Hi, I'm Lisa. Nice to meet you. Hi.
Lovely to meet you, Lisa.
Come through.
Thanks.
Now Lisa has to try to explain what might be wrong with their precious boy.
He looks to us like he's got a problem with his spine. When we pinch his toes on his right back leg, he doesn't seem to react. So to me, it's indicating that there's something putting pressure on his spinal cord, which is affecting those nerves that supply his back legs. It could be something like a slipped disc. It could be that he's had like a spinal stroke. Worst case scenario would be a tumour. As I'm listing the possibilities of what could be causing Skittles' problem, I see Rad and Nicole's face just drop. They are absolutely terrified that their baby may never walk again.
He's everything to us. He's like our kid. A lot of our lives revolve around him, so he's very special to us.
All right, well, hopefully we can get you an answer tonight, and hopefully it's something that we can treat. If not, hopefully it's something that's going to just get better.
Lisa's plan now is to do an immediate CT scan.
I'm just hoping that they can fix him and make sure everything's okay.
I think the first thing I'd like to see is just how well she's getting around right now.
Sure.
That gives us a good starting point.
Yep.
And then from there we can work out exactly what we're facing and what we need to look at. Okay.
In Carrara, outside Brisbane, Chris is trying to help Stubby, a 3-week-old piglet born with only one trotter.
There's no doubt the pressure's on. I mean, Belle and Tim have got me out here in the hope of coming up with a solution.
What I find interesting is when she does walk, she doesn't ever get her legs even close to being vertical.
She's got to think twice about where she puts her foot down.
I think she's doing that because she knows that those legs of hers are very sensitive. They don't have the padding underneath. They don't have that hoof to support her. And each little twig and each, I guess, little pebble that she hits would actually hurt her.
My concern is that if Stubby was born with these defects, then there's a chance she could have others. So a full check over is essential.
The inside of her mouth looks okay, no cleft palate. Her neck, her ribs, they all feel fine. And when I listen around her heart, I'm hearing very clear beats, which is important. So really, so far so good.
That's good.
That's good.
But we need to get to these legs though. So you can see she's getting these little pressure sores here. So that's where she's contacting the ground when she takes those steps. And this one's a little bit more raw too. So while she's managing to get around right now, you know, there are some warning signs that potentially some trouble brewing there. The issue we've got is without those trotters, her life is going to be truly limited. Because she just can't get around and carry around any sort of weight without them.
And she's going to grow.
Yeah.
The enormity of little Stubby's problem is beginning to sink in.
I'm just worried that, you know, we can't do anything to help her and that, you know, I can't provide her a life that, you know, she deserves.
So we need to find a way to help her support her growing weight.
I'm not
Do you have any ideas?
Yeah,
I'm glad you do.
I do.
As Stubby grows, her weight is going to become immense, and those stumps just structurally won't be able to support her. Plus, she only has a thin layer of skin covering them. So right now, the pressure is on to make sure this solution is one that works.
On 3, 1, 2, right. There we go.
At Sash, Skittles is about to undergo a CT scan.
So we're giving Skittles a general anaesthetic now. We're trying to work out what's going on in his spine.
Lisa has called in specialist surgeon Dr. Andrew Marchevsky in case the scan reveals that Skittles needs emergency surgery.
The possibilities here are that Skittles has had a spinal stroke, he's got a slipped disc, or worst case scenario, he's got a tumour there. We're really not going to know anything until we get this CT done.
Andrew is looking for any abnormality that might give him a clue as to why the big dog suddenly can't walk properly.
Just looking all through there's nothing really obvious that jumps out at us from this. I think we've got to go to a myelogram to be able to get a good look at the spinal cord.
All stable for now.
So we're going to do a myelogram now, which basically means we're going to inject a dye in and around the spinal cord. We need that to highlight it to see exactly what's going on. Righto. We've got a good scan here and really I can't see any evidence of compression of his cord by either a slip disc or a juvenile tumour or anything. So I guess that's good in one way because it means we don't have to take Skittles to surgery.
Yeah.
But it's bad because I guess we're really left with a diagnosis of spinal stroke.
Oh no. The results of the CT show that Skittles has spinal stroke, where part of the blood supply to that part of his spinal cord has been affected, causing his back legs to become paralysed.
It's a heartbreaking diagnosis, and there are no guarantees of a full recovery.
The longer he goes that he doesn't get feeling and he does get movement, the worse his chances are that he's ever going to get that leg to work again.
This condition can be quite devastating because it often happens in young, large dogs. Now, there is no specific treatment for this condition, and there is a chance that Skittles may never walk again.
Belle, you may have the most important job of all here. You have to keep our little miss still.
Chris is in Carrara, southwest of Brisbane, trying to help Stubby, a piglet born with just one trotter.
What I want to do first of all is clean up these feet here.
The energetic baby has captured the hearts of owners Belle and Tim, who are desperate for her to have a future.
Good girl.
So what we're going to do is actually going to cover up these feet here so we can't afford for them to have any infections there that could get any worse. All right, so what we're going to do now is all about trying to give her some sort of durability and some sort of comfort with those feet. So if we don't protect them, those pressure sores are going to develop into big open wounds. And as she gets bigger, that's going to be catastrophic for her. Basically, I'm trying to mimic exactly what nature didn't provide Stubby with. So normally, she would have a layer of fat on the base of her foot and then the harder material over the top of the trotter that acts as protection. So instead of that, I've got the padding, which is going to provide the cushioning. Then on top of that, the bandage provides the protection. All right, we're ready for a fitting.
Put her head up.
Let's sneak one on the back here. Yeah, okay. If we can. Like a glove. Beautiful. So now we'll tape this one on.
You're not being hurt. I think Chris's idea is awesome. I'm open to anything that lets Stubby just live a normal life.
Okay.
Moment of truth.
So, we now have 3 feet covered. Yep. So she's all bandaged up, but the big question is, can she walk? Basically, if she can't walk, then she just won't be able to survive.
Hello, Ray. We've just come down from Port Macquarie with Archie.
Oh, okay, yes, certainly. If you just want to take a seat, please.
Thank you very much. Thank you.
Worried dog owners Leah and Steve have just made a 5-hour mercy dash from northern New South Wales.
Yeah, we just have to sit and wait now, Archie.
Their much-loved poodle Archie has an alarming condition.
I woke up and I thought he had a ball in his mouth because he had his mouth open when he was running around the house. But then I realised he didn't have a ball in his mouth. So then I called Leah.
So I immediately put my hand down his throat, thinking he had something stuck. Couldn't find anything, so we hopped in the car and brought him down. And he still can't close his mouth.
Come on, Arch.
Hey, just go here.
Leah and Steve are hoping Lisa can tell them what's wrong.
Hey, buddy. Can you sit down for me?
Sit, Arch. Good boy.
Oh, wow, that really doesn't close, does it? It's fairly unusual to see a dog that can't shut its mouth. There are a few possible causes, but I really need to take a look at him to work out what's going on. So he can certainly move his tongue, and he seems like he can swallow, which is good as well. So that movement is working, the nerves that supply the tongue are working. I'm feeling along Archie's jaw bones, and it does feel quite uneven. One side there's a bony bulge that is not present on the other. Perhaps he's dislocated his jaw, he's popped his jaw out of place. The other possibility is that there is some sort of a growth there,
Right.
like a tumour. We're hoping it's not that, but he's a middle-aged dog, so I can't rule out something that's more
And he has
sinister
been
as
off
well.
colour.
To work out exactly what's going on, Lisa wants to take a CT scan of Archie's skull immediately.
We're hoping it's nothing serious, nothing life-threatening. We're hoping it's just a simple accident.
Archie, hop, 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 hop. Good boy. Oh, you're a good helper, Archie.
First, Archie has to be anaesthetised for the urgent CT scan.
I'm just gonna make you fall asleep now. Good boy, it's okay. You go down.
I'm hoping that it's a dislocated jaw, because if it is, we can pop it back in place. If it's not, and there's something like a tumour, well, that's not going to be very good for Archie at all. Okay, let's do it.
Did you see anything obvious?
The case is so unusual, Lisa has again called in specialist surgeon Dr. Andrew Marchevsky.
God, I've never seen that. I don't think I've even read about that happening.
We've got Archie's CT results, and it's quite unbelievable.
Where you can see this part of the jaw is actually sitting level or just slightly outside. It should be sitting in here like that, and it's sitting up here. Don't know how he's done that.
Archie has dislocated his jaw, but he hasn't done it in the regular up or down fashion. He's dislocated it to the side. So part of his jawbone is actually sitting on the outside of his cheekbone. Andrew and I have never seen anything like it.
His whole jaw has sort of just gone that way. But I guess the good thing is it looks like it's a trauma. There's no evidence of cancer or a lump or something that shouldn't be there.
And there's no broken bones or anything.
No, he hasn't.
So hopefully you can just pop it back into place.
Pop it back into place.
Just like that.
Magic hands. I think the best thing we can do for Archie is just manipulate it back into the right spot, because if we can't do that, then we're faced with going to surgery, and that's going to be much worse for him.
It's a big moment.
It is.
A lot of work gone into this.
Yep.
So let's see how these new feet go.
In Carrara near Brisbane, Chris and farmers Belle and Tim are about to find out if Stubby's new prosthetics will allow her to walk normally for the first time.
She's tired. Come on, it's all right.
If this doesn't work, the tiny piglet has no future.
They feel a bit different, sweetie.
Yeah.
Chris puts Stubby on the ground and she just kind of stops for a second. Stubby, what are you doing? And then she starts taking steps, and you can just see the look on her face like, oh my God, I'm not in any pain, and just the freedom she has to walk, and that just meant the world to me.
The thing about these is they're not necessarily all-terrain and all-weather. It's something that I reckon is worth trying here. Rubber stoppers off the base of chairs. These
What do you think, Stubbs?
could become an all-terrain form of transport. So I just wonder if we put her little foot in there.
Yep.
Look who has
A new trotter.
their own rubber boot.
That is pretty special.
The local hardware store isn't where I normally start looking for a solution to a piglet's problem. But funnily enough, these rubber stoppers look to be perfect. With her little gumboots on, I can't see why she can't get around the farm just like the other piglets. Oh, that's pretty good.
That is.
She's awesome, eh?
She's looking stoked. Look at her. That's seconds after she's had them on. So this will take hours, it'll take days for her to get used to walking in them, but she'll be running in them.
Oh, yeah.
What do you think, Stubbs?
Obviously in the future, as she does get bigger, she is going to need more help. She'll need bigger rubber shoes, but in Belle and Tim, she's got some very handy allies.
Thank you very much.
No worries at all.
Thank you.
My pleasure.
Before Chris came, we didn't know what the future would be for Stubby, but after he's seen her and spent so much time with her, it seems like her future's going to be really bright.
Hey, Archie. All right, so what I've got to do, I think we're going to have to open up his jaw, try and drag it open, put a bit of stretch on it for a little while, and then just see if we can drag it back in, because it's pretty tight.
At Sash, Andrew is hoping he can fix Archie's severely dislocated jaw without having to resort to surgery.
All right, well, let's see how we go with this.
Andrew's holding Archie's jaw and he's using quite a lot of force to try and put it back into place. And I'm thinking maybe it's not going to go right.
Oh, yeah.
Done?
I think so.
It's moving?
Yeah.
Well, that's good. Great.
So we'll just see if we can open it up and just see. Nah, gee, it goes.
So pop straight back out?
Yeah. Whilst his jaw went back together pretty easily, it comes out pretty easily as well, and I've been able to do that. So the problem we've got now is keeping it in the right spot. You know what we're going to have to do? I think if we pop a muzzle on him, I'll just keep that on for a couple of weeks, because I think the way he's going, if he opens his mouth up too wide again too soon, it'll just pop back out again.
Okay.
And I mean, if that happens, then we really will have to go to surgery to sort of...
Pin it in place.
Well, yeah, pretty much.
For devoted owners Steve and Leah, it's been an agonising wait.
Come through. Okay. So we did the CT scan and it shows that he actually had a really severely dislocated jaw. It was like locked in place. And the good news is we managed to pop it back in. Thank God. He's all right. He's okay. So he's awake. And
can we see him?
You can see him.
When Lisa said it wasn't a tumour, a huge weight lifted off us because that was what was in the back of our mind.
So the patient is just down here.
Hello, mate. Hello. It's all good. Told you we'd get you fixed. Hey, you're my good boy.
It's joy.
Yeah, it is. Pure joy. We've got our boy back.
Yeah, we have. We can take him home tomorrow.
Yes.
Yes.
Thank you so much for what you've done.
My pleasure.
You're a good boy. Give me a cuddle.
Hello. I've got a bit of a problem with my cockatiel. He had a bit of an accident this morning.
Okay, we'll get Chris to see you straight away. If you'd like to take a seat there, he won't be long.
Oh, there you go.
A distressed Bloss has arrived at the Bondi clinic with her injured cockatiel, Eric.
He flew out to have breakfast with me and I sort of looked around and he hit the floor, lost all power in his legs. So I'm hoping he hasn't broken his spine or anything. Hello.
What's happened?
Oh, we've got a bit of an accident here.
Concerns for
Bloss has got a lot of birds and therefore has a lot of experience with them. So for her to have rushed in here, I know straight away it must be serious. Did you see him hit the floor?
Well, sort of. Was all happened so fast. I heard him come out and then sort of looked around and he hit the floor as I looked.
Yeah.
And then flapped and I thought, oh, this is not good.
Yeah. Can he walk?
No.
No.
There's no control in his feet whatsoever.
We obviously see a lot of birds that fly into walls, and usually that impact is
Yes.
head on. I guess the unique thing for him is it's most likely he's taken the impact on his chest. But still, there's been a huge impact that's gone through his spinal cord and through his internal organs as well. There's no doubt that Eric has hit hard. The fact that he's now not moving his legs and really reluctant to use his wings is a significant cause for concern. My immediate reaction is that he's done something serious to his spine.
You're a good boy.
It's been 12 hours since Skittles was rushed into Sash after suffering sudden paralysis in his back legs.
I'm still really concerned about Skittles because he's a big dog. He's got one leg that's totally useless, one leg that's really weak. It's got to get a lot better before he's got a chance of ever getting up again.
The young pup has suffered a spinal stroke, and Andrew needs to speak with owner Rad about treatment for the Great Dane's serious condition.
So look, just as we discussed last night, the most likely thing we're dealing with is a spinal stroke. The bad news is the chance of Skittles getting full use of his right hind leg back is really only about 1 in 3. And that's not great odds.
Yeah.
This right leg could be months before he can use it properly. But it might also be never. And I guess the sooner we see some improvement, the more confident I'll be that he'll be able to use that leg. But the longer it takes, the sort of more pessimistic I'm going to get. All right, well, I think we'll go and visit.
Yes, please.
Yeah. All right. It's never great telling an owner that their dog's only got a 1 in 3 chance of ever using that leg again, but that's just the reality of it. And it's just going to be a waiting game, and it's going to be a really hard waiting game for him and me.
Hi, buddy.
Don't try and do too much, big fella.
Alright, hello, buddy. Oh, buddy, hello. I'm really scared that he won't be able to walk again. I really hope that that's not the scenario, and we're trying really hard not to think about that scenario. But we will do everything we can to make him comfortable and make sure that he's well looked after.
Everyone is trying to stay positive. But if Skittles doesn't regain use of his leg, Andrew knows the next option will be heartbreaking.
The harsh reality is that it's quite possible that we may have to amputate Skittles' leg, and that would be quite devastating.
Just as a first assessment, what I need to do is just work out whether he does even have any feeling in these feet here.
At the Bondi Clinic, Chris is examining cockatiel Eric. He's trying to work out if the 2-year-old sustained any serious damage after an awkward crash landing.
The reason I'm squeezing the toes there, it's very important. If he doesn't have any pain perception, then ultimately it means that there's no message going through whatsoever.
I understand that. Because
if the very inside of that spinal cord is damaged, then he won't even detect pain. If you look very closely, when I squeeze those toes, he's actually able to pull them back in. You can see him just tensing up those muscles there. And again on the other side.
Oh yes, they're moving.
They are moving.
That small movement of Eric's legs as he tries to pull them away, it doesn't seem like much, but it means the world to me, to Eric, and I'm sure to Bloss as well, because it means he does have some nerve function to those legs. But we need to check out the rest of his body to make sure there aren't other injuries.
He does actually have a little bit of bruising. It's actually quite swollen on his chest there.
It's quite nasty, isn't it?
And normally that muscle dips down from the sternum here, whereas it's actually bulging out.
For Eric to have this amount of bruising on his chest shows just how hard he hit the floor.
If he was going to land anywhere, that's probably a good spot though.
Really?
Because he's got a lot of muscle there around his sternum. It's essentially his breast muscles. The challenge though is that his spinal cord sits about 1 centimetre behind there.
Given the bruising that Eric has on his chest, he's obviously hit hard. If he's hit at some sort of angle, it's very easy for that spine to bend to the point where it snaps. So an X-ray of his spine really is crucial to make sure that his spinal cord isn't hanging by a thread.
Hey, Archie. Hi, buddy. How you going? Hey, where you going? Hey, you want to bolt out of the door with that muzzle on? Hey?
At Sash, Archie is bouncing back after treatment on his severely dislocated jaw.
So it's pretty obvious that Archie's doing really well. I think he wants to get out of the door, so that's where we're going.
Owners Leah and Steve are also excited to see their special boy.
Looking forward to seeing him this morning. We'll know when Archie comes out that door how he's feeling.
What a reunion. Archie is jumping all over Leah and Steve. They are so happy that he is fully recovered and they cannot wait to get him out the door. What muzzle, huh?
Yeah, what muzzle?
He doesn't even know that it's there. Because because Archie has had such a severe dislocation in his jaw, it's really, really important that we keep a muzzle on him to try and hold his jaw back in place while those jaw muscles heal up.
Lisa, thank you so much for what you've done for it. It's been great. You've done everything so well. It's been wonderful.
All right, mister. He's out the door.
I know.
You better go after him.
He knows where the door is. I'm very relieved to be taking Archie home and very relieved that it's all over. They've actually done a fantastic job here, so we're very grateful.
Bye, sweetie.
Come on, Archie, I'm off.
Good boy.
We're looking at what could be a spinal injury, but we just don't know for sure.
At the Bondi Clinic, Chris is about to x-ray 2-year-old Eric.
X-ray.
The cockatiel crash-landed after attempting to fly from his cage this morning.
My worst nightmare would be to look at these x-rays and see a fracture in Eric's spine or in his wing, because ultimately either of those would mean the end for him.
I feel positive at the moment. I think if there's anything can be done, Chris will do it, because he's saved a couple of my other birds.
My biggest concern here has been that Eric's had some sort of spinal fracture which was about to sever his spinal cord. Looking at it though, it's pretty well aligned. All his long bones are actually intact, there's no fractures there. So what he probably has is nerve bruising. The good news is there are no fractures there.
Good, that's
which
good.
is good. So what you're seeing here is essentially shock and spinal shock. In the impact of landing the way he did, he's actually compressed his spinal cord and probably a lot of the nerves there, but it hasn't actually caused any sort of significant trauma.
Yeah, I'm very pleased, really relieved that it wasn't, a fracture or a spinal cut or something like that.
So what he needs, anti-inflammatories into the muscle. If we give them straight away, we'll start to reverse the effect of that swelling.
Where you go, Eric?
The final step in Eric's treatment is a soothing ice pack.
The whole point of the ice is much like a human with an injury. It takes away the swelling, takes away that extra heat, and makes him feel a lot more comfortable. Okay, so that's probably enough icing. If you take that with you.
Okay.
What we're looking for is just gradual improvement each day. I think it might be a week or so before he's seen back to normal.
Okay then.
There's obvious relief from BLOS that the injuries that Eric suffered haven't been life-threatening.
Hopefully with some rest, the lucky cockatiel should regain full mobility.
You call me if there are any problems though.
Okay, thank you. I'm feeling quite positive about the outcome now. It's just a matter of going home nursing him. Come on, Eric, come on.
All right, Skittles, wanna go for a little walk? Hey, we'll get those legs moving, see what you can do.
At Sash, 18-month-old Skittles is undergoing treatment for a rare spinal stroke, which has paralysed his 2 hind legs.
So we're walking Skittles around to try and get his legs moving again. It's all part of his physical therapy, part of his rehabilitation. We really need to start training those muscles to work again.
Come on, let's go see Skittles.
Today, owner Rad is bringing in a special visitor.
There he is.
Hi, how are you?
It's Skittles' sister, Soda.
Oh, Skittles, your family's here.
Hey. Soda's been very lonely at home. She's been sulking a lot. So today was the first day that I saw a little bit more excitement in her since Skittles left.
All right, let's show Dad what you can do.
He's a clever boy.
The visits are really good for Skittles. It keeps his spirits up and it reminds him of home. So that sort of thing is what's going to get him going. He does have some sensation and some movement there, and obviously there are no guarantees that down the track it's ever going to be completely normal, and we're going to have to give him time and physio and nursing care, and the rest is up to him.
Come on, buddy. Oh, you're doing so good, aren't you, buddy?
Our worst fear at the moment really is that he's going to need that leg amputated, so we are worried about that, but we'll do whatever's best for him.
All right, I think we better get him inside, give him a little rest.
I think so.
Okay, so visits are welcome anytime, and we're just going to continue with the rehab and the physio, and fingers crossed he just
Lovely. You guys are doing such a good job. Thank you so much.
Fine. It's what we're here for.
All right, buddy. Mwah.
I'm seeing some progress in Skittles, but he's still got a long way to go. This is going to be a very lengthy recovery period, and there are no guarantees that he's ever going to use that leg again.
Hey guys, we've just had these brought in at reception. Do you want to come have a look? Look how cute they are.
Inside at Sash, stray ducks are getting a noisy reception.
Aww. They are real cute.
Do you know what kind of ducks they are?
Not too sure. So we've had two little adorable ducklings just brought in. A member of the public had found them on the side of the road. We're just going to have them looked over just to make sure they're nice and healthy, and we'll have our wildlife nurse have a look at them.
So we'll just make sure everything's okay. So the eyes look good, got a nice clean beak, nothing stuck in your mouth, it seems to work. Little wings, they seem to be intact. Now look at your feet, they both work, don't seem to have any cuts or injuries. These ducklings look great, they've been well fed wherever they've been, they're in fantastic condition.
It's a clean bill of health, and Jess is confident the pair aren't native ducks.
Most commonly, white ducks are domestic ducks and they don't actually belong in the wild, they belong as backyard pets.
Okay.
So we're going to have to keep you here until we can find you somebody who's going to love you and give you a good home.
Yeah, I think so, and I think they will.
Hey, find you a home? Yes. Hey, buddy. Hey, we're going to do some rehab on you.
So what we might do while he's standing up, because he's eager to get moving, is get him to do some figure eights.
Okay.
Because that way he's going to be using each of those hind legs.
Good boy, Skittles.
At Sash, 2 weeks of intensive physiotherapy with spinal stroke patient Skittles is finally starting to show results.
Good boy. We're so lucky here at Sash to have Rebecca, who's an animal rehabilitation specialist, working with Skittles every day. She's performing exercises with him to strengthen up his muscles and get those legs moving so that eventually he'll be able to do it on his own.
So, let's go, mister.
The brave Great Dane has been undergoing daily rehabilitation.
Good boy.
And if he can get through today's session, he'll be ready to leave Sash.
Good. Come on, mister.
Good boy.
Good boy. I mean, when this dog came in, he couldn't even stand up, and now he's walking, and I think, wow, this boy is definitely ready to go home.
I'm so proud of you, mister.
We're really pleased with the progress. It's by no means over, and I don't think it's going to be an easy road, but we're really hoping that he's going to have a full recovery.
Yeah, you're running. Look who's there.
Hello, buddy.
When Rad and Skittles finally see each other, there are just slobbery kisses all over the place. Oh, he's so excited to be back with his daddy. All right, so you're all ready to go with all the rehab at home?
Yeah, we've got everything set up.
Perfect.
We've got a nice bed for him.
Excellent.
And I think we're good to go.
Great.
It's been a crazy last couple of weeks, but I think having Skittles home is going to make both Nicole and I incredibly happy.
All right, Skittles, let's get you out of here. Hey, bud. All right, well, he's going out. It's no more me teaching him how to walk. He's taking me for a walk.
Come on, let's go.
Skittles.
Let's go.
That is progress, huh?
It is.
When the dog walks the vet, we know he's come far. Rad has been so patient with Skittles' recovery. I don't think he quite knows what he's in for once he gets home with this big dog who needs a lot of rehab. But he's a dedicated owner, so I'm sure he'll manage.
Good boy. That's a good boy.
Here we are. Oh, look at this. It's your new home. Look, we've got some new friends for you. A big pond to swim in.
As for the 2 little lost ducklings which were found wandering on the side of the road, they've now been adopted by Sash vet nurse and duck lover, Jess.
I've fallen in love with the ducklings, so I've decided to take the ducklings home. There we go. Go find your friends. We've got a great setup. It's like a duck palace. We've got the wading pool, we've got the running area, they've got their little house. I think it'll be great. I think they'll love it. Happy chuckles, always a good sign. I've got the perfect names picked out for our male and female ducklings, Andrew and Lisa. What do you think about that? You like those names? Yeah? I'm hoping that because the ducklings are young, they'll be welcomed into the group with open arms, open wings.
Gonna go for a run, buddy?
And 3 months after Skittles suffered a debilitating spinal stroke,
go on.
The Great Dane has made a remarkable recovery.
We were told there was a 30% chance of Skittles being able to walk again or get any function back again, let alone walk and run around, and he's improved so much out of sight that we couldn't have asked for anything more.
Go on. Go get it.
He's such a strong dog and he's so determined. We really hoped and knew that things would be better.
Go on, buddy.
Soda and Skittles are very happy together again, and Soda's very happy to have her friend back, so it's great to see them both together again.